Okay. Good morning. Week 4. Last week, there's only one class left after today. Wednesday, yeah. It is really close. You guys had 2 chapters over the weekend, chapters 8 and 9. Let me go ahead and get your scores. So, Doodleen, Ariella, Callie, thank you. Carol, thank you. Evelyn, thank you. Courtney, thank you. Christian, Kayla, Virgie, thank you. Diana, Faith, Teresa, Kaylee, Tammy. Okay, Tammy, I need 1 through 7 from you. Somehow I've missed them.
1 was 9. Chapter 3, I missed 2. 4 was 9. Maybe 5.
5.
5 was 9.
6.
9.
7.
9.
Thank you.
1. 7 was 1.
Okay, got it. Thank you. And Christina?
None.
Thank you. Does anybody have any questions on what you missed? Anything you need me to go over? Anything you want me to explain? Anything?
I do, but not on the test.
Okay, what?
And I don't know that it doesn't have anything to do with the testing, but on the getting the water and with the ice scoop and stuff, most of the times the ice is not in the same room.
Okay.
So how do we do that?
So if you don't mind, I'm going to pull up a chair today. I've pulled a muscle in my hip. Sneezing. Sneezing. This is what happens as you age, right? Things that you wouldn't normally have a problem with. Yeah, I mean, you can sleep wrong, put your shoulder out for 3 days. So we have to keep this in mind when we're working with our older individuals, because things that, you won't think twice about might affect their ability to do things that particular day. So use me as a warning. All right. So let's talk about the ice situation. Every facility is going to handle this a little bit differently. Okay. And what I mean by that is, let's go to a hospital real quick. Okay. Now, even within hospitals, you're going to have variations of this. But in a hospital, a lot of times the CNAs will make hospitality rounds, which means that they'll do all of their vital signs, because they're going to need to give that information to the nurse. And then they'll go around with a cart with an ice chest and, fill everybody's ice buckets. Okay. So that's a lot of times how we handle this in acute care. So rehabs and hospitals, it's a cart with a big cooler with ice in it. That cooler and that ice scoop should be cleaned at night, because everybody's sleeping. We're not distributing ice. So usually part of the overnight shift is to clean things that are used on a daily basis. So cleaning wheelchairs, cleaning, the handrails down the hallway, cleaning ice chests, things like that. Now, in a longer term care setting, this changes a little bit. A lot of times they won't use big carts of ice. Everyone is going to handle this a little bit differently. And I kind of have to explain why real quick. A lot of long-term care settings have CNA programs as part of their workforce. So basically they can hire you, they can put you through a CNA class in their setting, and you can actually work for them for 4 months before you have to get certified. Okay. Now, those people, when they're being trained, can't do bed baths because they don't know how to do bed baths yet, and yet the facility is paying them. So a lot of times these non-patient care activities, non-direct care activities, are going to be assigned to these new hires specifically to get them used to the facility layout, right? Where all the rooms are, how to talk to people. That, believe it or not, that is a big task to learn, is how to talk to a stranger. And not all of you are comfortable talking to strangers. So if you're not comfortable talking to strangers, you're going to have a really hard time in a clinical setting because you know what we have to do? Talk to strangers all day long. Now, I know that because I listen to you do your opening. Your opening tells me how comfortable you are talking to strangers. If you're comfortable talking to strangers, your opening is going to be, "Hi, Miss Jones. My name is Patty. I'm your CNA." You're just going to, it's natural. It's normal. It's fine. You know, you're not all uptight. If you aren't comfortable talking to strangers, your opening is going to sound like this. "Hi, Miss Jones. I'm Patty. I'm your CNA today. And is that okay? No. I'm here to do some range of motion. Is that okay?" Right? You kind of have to think your way through it. You have to think about all the steps. All those steps are important, yes. But if you're used to talking to strangers, all those steps make sense and it becomes a little bit easier. Does that make sense? Now, if you find that you are uncomfortable talking to strangers, I suggest when you're in line at Walmart, turn around to the person behind you and say hello. I know it sounds weird. Sounds weird. Instead of going through the drive-through, get out of your car and go in. Go where people are and start talking to them. That will help you in healthcare overall. Does that make sense? But a lot of these brand new CNA students that are working for a facility, they don't have that skill yet. So we assign them tasks like go in, get the water pitchers, take them to, do it room by room. There's 2 people, take their water pitchers to the nutrition room, clean them, fill them with ice and water, and return them. So every facility is going to handle this a little bit differently. As far as whether it's a cart that goes room to room, and the cart stays outside. We just bring the water pitchers out to the cart. You definitely don't want to be doing this in a isolation room. Everything in an isolation room stays in the isolation room. So don't bring a pitcher out. But for the most part, it's going to be either a cart in the hallway or you'll have to take the pitchers to the nutrition room, clean them and fill them and return them. So it really kind of depends. But either way, those items need to be cleaned out on a regular basis. And that's actually a supervisor. I know it sounds weird, but that's actually a supervisor's responsibility, is to check to see how often these things are, anything that's warm, dark, moist, right? And a cooler after the ice has melted is certainly warm, dark, moist. Anything that's warm, dark, moist, that supervisor is supposed to be checking on a regular basis to make sure it's being cleaned properly. So does that help you? Every situation is going to be a little different.
I have a question about the state test. I've been venturing on Google a little bit about common errors that cause failures on the exam. And I'm thinking it's like point deduction also, but it mentioned not using hand sanitizer after removing your gloves.
So Prometric does not grade on the use of hand sanitizer specifically. They call it hand hygiene. Okay. So it's important to make that distinction. There are some states that do require the use of hand sanitizer. Prometric states are not among those. For prometric states specifically, you must wash your hands, not rely on the use of hand sanitizer. So you're going to wash your hands at the beginning of skill 1. So, hi, Ms. Jones. My name is Patty. I'm your CNA today. I'm here to whatever. Is that okay? Close curtain. Go to the sink, turn the water on, get your hands wet, apply soap, rub for 20 seconds, all surfaces, move to your nails, circle your nails, rinse, keeping the water in the sink, tap, dry, and then turn your faucet off. Go do your skill. At the end of the skill, thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Bed's in a low position, environment's clean. Here's your call light. Let me open the curtain and go wash my hands. You're physically going to go to the sink, use real soap, real water, really wash your hands. Those two are graded, okay? After that first skill, that evaluator is going to tell you you can simulate hand washing from this point. Simulate means say. So you're simply going to say, I would go to the sink and wash my hands now.
After removing gloves. That's the impression I got from.
So, okay, so you're talking about specifically, so after removing gloves for prometric is after the closing. So you've removed your gloves, you've done your closing, you've washed your hands. So hand hygiene is done at the end of the skill.
I just got the impression that somewhere in between.
No, no. Most prometric testing centers don't even have hand sanitizer available. So if you want to go wash your hands after removing gloves, you can. There's no restriction on how many times you go wash your hands. So if you want to go wash your hands, that's fine, but it's not a tested checkpoint. Okay. And if you look at, you've got the testing checkpoints right there. There is nothing on there. So look in the last column.
Right, that's why I'm asking, because it mentioned it under in Google under for the state of Florida.
Yes, Jake.
A comment asked, when a student asks a question, could you please repeat it so the ones on video can hear it clearly as well?
Yes, thank you. Thank you. So the question is, yeah, good call. Thank you. So the question is, on Google, under Florida, it says specifically under common testing errors that you must use hand sanitizer after removing gloves. That's a common testing error. And I'm going to tell you that unfortunately, Google does not always give you the right information. So you can, don't trust me, right? I may not be giving you the right information. How would you know? You need to go directly to the source. Go look at the testing checklists. They're published for you. They're on Prometric's same website you go to apply for the test. The checklists are on there. Go look at the checklists and you'll see that that is not a tested checkpoint. So if it's not a tested checkpoint, therefore it can't fail you on the state exam. It's not a tested checkpoint. What is tested is end skill with clean hands. So that's what we want to pay attention to. And the problem is that a lot of people will go onto Google, they'll do that search. It says use hand sanitizer or wash your hands after you remove your gloves. Well, you take care of a bedpan, you remove your gloves, you go wash your hands, and then you come back and you give them their call light. You take off the privacy blanket, you pull up the sheet, you touch the curtain. Did you end skill with clean hands? No, and you fail. Because you're taking all of that patient's cooties to somebody else. It's not as much about giving this patient their own cooties. And that's what happens when we take off gloves, right? We've worked with this patient. We wore gloves. We took those gloves off. The only thing that may have gotten through those gloves is this patient's cooties. Nobody else's, because we're not working with anybody else. So the patient has, they're familiar. They're on first name basis with their own cooties. It's not a big deal. But taking this guy's cooties to that patient, that is a big deal. So in a roundabout way, that advice is correct. You do have to wash your hands or use hand sanitizer after removing the gloves. but it's much more important to do it at the end of the skill. And you can accomplish both of those things by washing your hands at the end of the closing. Okay, does that make sense? Okay. So if you are uncertain, if you are feeling a bit insecure about testing, and you guys should all be feeling a bit insecure about testing at this point, right? Because we are only one day away from ending the class, which means your test is on the horizon. If you have not registered, you should register, because your confidence level is not going to get any better once you're out of this classroom. It's not going to, that the confidence fairy is not going to show up on Wednesday night and hit you with its magic wand and say, okay, you're ready to test. It doesn't work like that. You just need to go do it. But if you are suffering from a lack of belief in yourself, a lack of belief in your skill level, a lack of belief in me, then I want you to go on to my YouTube channel. And don't watch the videos. I want you to look at the comments. Look at the comments. Now, we see them on the screen all the time, but I want you to go look at the comments, because most of my videos have thousands of comments. Thousands of comments. And a lot of them are, I took my test, I did it just this way, and I passed. So believe the people that have used these resources and were successful rather than believing me. Okay?
Are you still doing, like, I believe in the beginning you said after Wednesday ends, like next week we can still plan classes?
Yep, and that's actually something I'm going to talk about today. So next Monday and Wednesday from 9 to 1, so classroom hours, you guys can come in here and practice. And Jake's going to be passing around after break. Jake will be passing around the sign-up sheet for that. We do recommend that you sign up for practice times. And if you can't come, please send us an email and say, hey, I'm not going to make it. Because, well, the last class session, we opened it up. We had somebody sign up for 9 a.m. Jake came and he sat here and he sat here and he sat here. And that's unproductive time for him. You know, I mean, nobody showed up. So he's just sitting here. He can't work on his stuff, you know, that he has to do from this computer. So he's just basically sitting here playing on his phone, and I get to pay for that. So we open it for you. You have the supplies, you have the mannequin, you have everything that you need to practice, and we encourage you to make use of that. But if you're not going to come, please just let me know so that I don't have to have him here. Does that make sense? Good, good. Any other questions on the state exam? All right, we've talked a little bit about the skills exam. Let's talk about the written exam real quick before we go on. Tomorrow is the game show. Tomorrow's questions are going to revolve around safety. And a hallmark of safety questions is that they require action. Safety always requires action. Not notification, action. And notification does have to happen. It'll come later. But if somebody is in the middle of falling, we're not going to leave them and go get the nurse, right? We have to deal with the situation. If there is a fire, we have to do something with that patient. If there is a flood, we have to do something with that patient. If the patient is having chest pains, we have to do something with that patient, right? So safety requires action. So the right answer is not notify the nurse. Now that is the right answer for almost everything else that we do, right? Except for safety. So tomorrow's questions are going to have a scenario where your patient is somehow in some sort of distress, and your answer will not be notify the nurse. We have to take an action. Does that make sense? Not, I'm sorry, 11 a.m. So the first and third Tuesday of every month at 11 a.m. on my YouTube channel. Right afterwards. Oh my goodness. Well, good vibes out to him. Good vibes. Yes, I can imagine. I can imagine. All right. So, but let's talk about the rest of the, so we know safety requires action. So you should be able to look at any safety question now and eliminate answers and come up with, even if you didn't know the right answer, you should be able to eliminate to find the right answer. Okay. But let's look at the other 6 categories of questions. Okay. So one of them is CNA, and that's the easiest one because CNAs report everything to the nurse. That's what we do, right? So CNA, for the purposes of the written test, stands for changes, need, assessment. And the nurses are the ones that assess. So if you notice a change, we have to report it. It's that simple. So if the question has any sort of a change, if it says the CNA notices, that's your key word. The CNA notices, that's a change. The CNA notices the patient's had a 3-pound weight gain over the past week. Well, changes need assessment, right? Report it to the nurse. So CNA questions, those are super easy. If there's a change, we notify the nurse. Then we get to FACTS, F-A-C-T-S. F is follow the care plan. Now, these questions are super easy to figure out because the question says the CNA is assigned to, or you are told to. Well, if you're being assigned, or if you're being told to do something, or if the care plan indicates that you do something, what do we do with care plans? Follow them. So look for the answer that follows the care plan. Now, they try to make these questions a little trickier. They'll usually end with, you'll have a question that says, the care plan instructs the CNA to do range of motion on the left shoulder. The patient states that the other CNAs have been doing range of motion on the right shoulder. Okay, so the rest of that sentence is designed to distract you from, we're going to follow the care plan. Okay, so if the care plan tells us to do range of motion on the left shoulder and the patient says, well, everybody else has been doing it on the right, what are we going to do with that? We're going to follow the care plan. We're probably going to let the nurse know too that we're not doing the right thing on this patient. You know, we definitely need to let somebody know. But follow the care plan questions are super easy because it'll tell you there's a care plan and then it'll tell you why you shouldn't follow it. So we follow the care plan. Or if we can't follow the care plan, we're going to encourage the patient to follow the care plan. And these questions would be like this. You are assigned to give a patient a shower on second shift on Tuesdays and Thursdays. The patient says that they're too tired to shower. What is an appropriate action? A, move the patient's showers to morning shift. B, chart that the patient is non-compliant. C, encourage the patient to shower. Or D, tell the family that the patient isn't cooperative. Yeah, we're going to encourage them. So we follow the care plan. We encourage the patient to follow the care plan. And if we can't do that, we notify the nurse. It's a progression. So we look at the question. What are we supposed to do? We look at what they're telling us, the reason that we can't do it. And then we figure out, do we follow the care plan? Do we encourage them to follow the care plan? Or is this something we need to notify the nurse on? So if the patient insists that they don't want to take a shower, well, then we would notify the nurse. If you ever see a word like force, restrict, make them, punish them, those are never the right answers. Get rid of those answers. That is not the role of a CNA at all. Good? So now you know how to answer all follow the care plan questions. I could give you a million examples, but they're all answered the same way. So let's go on to A. That was F, follow the care plan. Let's go on to A. A is apply the skill. That is everything on that back wall. If we get water, who checks it? Yeah, us and the patient. Yeah, that is a principle. We have to know during bathing skills, we check the water, they check the water. If we are going to have the patient uncovered or undressed, what do we have to give them? Privacy blanket. Where the patient should always be where in the bed? In the middle of the bed, right? You know all these principles. You're just going to have some questions that ask you to apply them, and that's why we had to learn them, okay? Those are easy ones by the time I'm done with you. If you answer all of those questions in each skill that we have learned, those are apply the skill questions. Those are the types of questions you would see on the state exam for apply the skill questions. So if you have not done that, remember every lesson that we go through, every skill, there's 5 questions or so for each skill. Make sure that you're answering those because those are the types of questions you might see on the state exam. Gray boxes, yep, for the skills. Now, I also have gray boxes for the lessons. Those are theory questions, which we're going to get to. That's T. We're not quite there yet. So we have gray boxes for skills. That's the apply the skills questions. So that's the F is follow the care plan. A is apply the skill, apply the principles. C is communication. Yeah, we have to be comfortable talking to strangers. And I know it's not easy, but I've got some very quick rules that you can use for communication questions. Communication questions are easy to spot. Oh, let me go back real quick. Apply the principles questions. Those are easy to spot too. Apply the principles questions will always say the name of the skill. You are performing range of motion. You are doing foot care. You are taking a pulse. It always says the name of the skill. If it says you are assigned to, that's a follow the care plan question. If it says you are performing, that's a skills question. Got it? Okay. Follow the care plan questions. You are assigned to. We follow the care plan. We encourage them or we notify the nurse. Those answers are easy. Apply the skill questions. It just says the skill. You are performing foot care. What is an important consideration? Okay, when you're putting on the sock. What is an important consideration when you're putting on the sock? Well, you'd want to minimize wrinkles. We know that. That's a principle. Okay, good. That's going to drive me nuts. Okay. So that's apply the skill. Those are easy to notify because you see the name of the skill right there in the question. So let's go on to communication questions. Communication questions are easy to identify because it says, how should the CNA respond? What should the CNA say? So the question will actually tell you it's a communication question. How do you respond? What do you say? That's obviously communication. So we have some rules here too. These rules are easy. So it's called read the room, READ, read the room. Respect, empathy, acknowledgement, and discretion. Respect, empathy, acknowledgement, and discretion. So I'm looking for an answer that acknowledges the patient. I'm looking for an answer that is respectful. I'm looking for an answer that has empathy. Not, oh yeah, I know exactly how you feel. That's not what we're looking for. You do not know exactly how anybody feels. What we're looking for is that must be difficult for you. Or would you like to talk about that? Respect, empathy, acknowledge, discretion. Those are the answers that we're looking for. Okay. Now, that's for regular communication, but not all communication is regular. Sometimes we have dementia communication. We've talked about this before. Dementia communication, the answer is redirect. If your patient is exhibiting negative behaviors, redirect. If they keep asking, when's lunch, when's lunch, when's lunch, when's lunch, when's lunch, and they're stuck like a record, we're going to redirect. Just like you guys are all so young, but before we used to have record players, and sometimes that needle would get stuck in a groove. The only way to make it move is to move it, to get it out of that groove. That's exactly what we're doing with our patients. We're going to get them out of the groove so they get something new to say. Okay. So with dementia patients, we redirect. Good. So that's how you answer communication questions. If it's normal communication, read the room. If it's dementia communication, redirect. Now you know how to answer all communication questions. T is theory. Now, theory is all the homework reading. That's the hard one because there's so much content. What are they going to ask me? This is where your chapter questions come in. This is where the gray boxes on my lessons in my book come in. You're gathering information. You're picking wildflowers because you're not real sure what the bouquet is going to require later. Okay. So this is just, it could come from anything that you've read, those types of questions. The good news is there's only about 10 of those on the test. There aren't very many theory questions. Now, this is where most CNA students go wrong because this is what you think the test is going to be about. You think the test is going to challenge you to know supine from Sims position. You guys should all know that after your reading, though. You think that the state test is going to ask you about Maslow's hierarchy. And there may be one question on Maslow's hierarchy from way back in chapter 3. That's Maslow, not nearly as hard as everybody makes him out to be. Maslow's pretty easy. Anybody ever have a toothache? When you have a toothache and you are really hurting, can you concentrate on anything else? No, that toothache is front and center, right? Okay, that's Maslow's hierarchy. That is absolutely Maslow's hierarchy. You cannot concentrate or fulfill anything higher when an immediate need is not being met. So our basic and immediate needs are things like oxygen. You have to be able to breathe. If you can't breathe, nothing else matters. You think I really want to eat lunch if I can't breathe? No. If you can't breathe, nothing else matters. So food, water, air. Basic. If you don't have enough food, if you don't have enough water, if you don't have enough air, nothing else matters. It doesn't even exist in your world. But once you have enough food, water, and air, well, now we can kind of go up a level, right? That now we're thinking about safety and security. So let's look at homeless people. Homeless people have food, water, and air. Okay, we're good. But they don't have safety and security. They're living in the woods in 100-degree heat. That's miserable. Do you think they're really worried too much about the state of the politics in this country? No. They couldn't care less because they don't have a roof over their head, right? So if you can't meet the immediate need, nothing above that immediate need is even relevant to you. So if we have a toothache, we don't care about what's going on in the activity room. We don't care about a shower. We want this need taken care of right now. And I don't care what you have planned. I don't care that I'm on the shower schedule for today. That's not relevant to me. Fix this first. That's Maslow's hierarchy. And we do have to understand that because we're going to be working with people on all different levels of that hierarchy. And we need to understand that we have to meet them where they're at. We can't expect them to move up a few levels just because it's convenient for us. Okay, so you may have a question on Maslow's hierarchy. Meet them where they're at. That's your answer. Good? But that's where everybody thinks that the majority of questions are coming from on the state exam. It's not. You are only going to have like 8 or 10 questions on that meet that theory threshold. Everything else is basically what you do as a CNA. How do you communicate with your patients? How do you perform the skills? How do you ensure safety? Do you know to follow the care plan? Okay, good. Do we understand that what we notice has to be reported? That's where all of the questions are going to come from. You will have a few sprinkled in about, you know, your theory, but that's the smallest area of the state. It's the one you think is going to have the most questions, and it's not. It's actually flopped. Good. So F is follow the care plan. How do we answer those questions? Follow the care plan. Encourage the patient to follow the care plan or notify the nurse. A is apply the principles, right? Everything we've learned on that back wall. C is communication. Read the room or redirect. That's it. That's all you have to know for communication. T is theory. That's everything that we've learned along the way. And then S is safety, and safety requires action. Take care of the patient. You now have all of the information you need to pass the written test. It literally is that easy. I just gave you a formula for every single category. So when you're reading that question, if it says you are assigned to, you know, it's a follow the care plan question. I either have to find the answer that follows the care plan, or I have to encourage patient to follow the care plan, or I have to notify the nurse. Don't ever pick notify the nurse until you've encouraged them. You read a question that has the name of a skill. Doesn't say you're assigned to, but the name of the skill is there. It says you're doing the skill. That's an apply the skill. So everything on that back wall, know it, apply it. You're reading a question that says, how are you going to respond? Or what are you going to say? Well, that's a communication question. That's easy. I'm going to read the room or redirect. That's it. It's going to ask you what you know. Now, theory questions are usually which of the following applies, or all of the following except, or they're not how questions, because how questions are apply the skill questions. These are more like what questions. So if you see what or which, that's probably a theory question. And then safety questions, those are pretty easy. Your patient is in mortal jeopardy. What are you going to do about it? Changes, CNA notices. Patient says there's a change. Okay, good. So written test, super easy. Now, if you want questions to see how these are going to be presented to you, I have a practice test framework, everything I just told you, but I have, as I explain the F, A, C, T, S, C, and A, as I explain them, I give you 10 questions to show you how to apply them. Then there's 2 30-question application tests, and then there's 3 60-question tests, all in this download. It is something I do charge for. I normally charge $24.99 for it to get that many, you know, questions. But if you apply the code number 4 success, it'll knock it down to $14.99. So you guys have that available to you. Watch the game show, though. I do the game show for free. And we go over one of those for each game show. Okay, tomorrow is safety. Game show's free. But if you want them all together, if you want a true practice book, then that framework would be good for you. It's on our website. It's on, Jake, can you put up shop for, yeah, there you go. Well, that's the code. Yeah, it's shop.foryourcna.com. Shop.foryourcna.com for success. That'll give you $10 off. Jake, we need to add that to the after class wrap up email too. There it is. Yeah, we actually need to change that, Jake.
Well,
It'll redirect.
yeah, it redirects.
Yeah. Hey, can you bring me my drink, please? Thank you. Yes. Yep, the framework. Yep, that's it. Yeah, once you learn this framework, as you're going through those questions, you're going to go, oh my gosh, this is so easy. Is the test really going to be this easy? And the answer is yeah. Once you know the key, those questions are like super simple. All right, only one class left. If you haven't registered for the test yet, you need to. You're not going to get any more confident after today. You're just not. Care plan sets are still available for you if you want them. Game show is tomorrow at 11 a.m. on my YouTube channel. If you have signed up for text messages from us, if you've signed up, Jake sends the text message out about 15 minutes before I go live, and all you have to do is click on it and it'll take you right in. Okay, so if you've not signed up for our text messages, just go to courses.foryourcna.com. A pop-up shows up. That pop-up, when it comes up, put your phone number in there, and that'll enroll you in the text messages. And then once you're done with your test, you just can unsubscribe. That way we're not sending out text messages to people who don't want it. Yeah, I've got people that we have some regulars on there that show up every game show, and they've been certified for years. They just think it's fun, and they compete for prizes. So we've got quite a few regulars that show up. All right, CPR. Let's talk about CPR. CPR, you do not need it for this class. You do not need it for the test. You will need it to work. So if you do not have CPR, this is on your first day handout, the blue sheet, this QR code. Use this to sign up for Julie's class because it gives you a discount. Okay, it gives you a discount. Yeah, I don't know how much she charges. I can't even keep up with my own prices, so I don't quote anybody else's. But use the QR code and it'll give you a discount. All right, so now we want to kind of shift gears. We have 3 skills to learn today. We're going to get into those in just a few minutes. Most of them are variations of things we've already learned, so it doesn't take a whole lot of time today. But I want to talk about this. You guys should all be starting to think now about where you might want to work after you get certified, okay? This should be on your mind. You took the class to get a job. So you got to have to figure out what kind of a job are you looking for. Not all CNA positions are the same. CNAs can work in mental health. That is a completely different type of CNA work than working in pediatrics. Pediatrics is a completely different type of work than working in a nursing home. A nursing home is a completely different type of CNA work than working in the hospital. And that's completely different than working in a walk-in clinic. CNAs can work in a lot of different places. Now, which one is right for you? That's what you have to figure out. And they're not all equal. I am a very high energy person. I have to be able to solve problems. I am not the kind of person that can clock into a job and do the exact same thing all day, every day. I will go insane. I'll create a problem to solve. That's just the way I am. So for me, working as a floor nurse, where I started out my career in long-term care, it's the same thing every day. You go in, you get report, you do your pill pass, you do your treatments, you do your second pill pass, you do your assessments, and then you give report and clock out. It's the same thing every single day, and I was bored out of my mind. So later in my career, I realized that I finally got it. okay, maybe if I change a different area, I'll be happier. So I got some additional training, went into critical care, loved it. Critical care was right up my alley. I had to use my brain. My patients were all over the place. And man, talk about changes. I had to be on my feet. Great, great place for me. Didn't like my supervisor though. Really had a personality conflict. I tried really, really hard, stuck it out for several years, and finally left and went to work for hospice. That's where I really found my groove. Hospice was my jam. I loved it. It was never the same thing. Got to go into different places all the time, got to meet different people, got to solve different problems. It was a fantastic work environment for me. But it's not for everybody. You got to figure out where the right place for you is. Now, some of this is going to depend on your personality. Some of it will depend on your personal situation. If you've got young children and you don't have a support structure, you aren't going to be able to work 12-hour shifts because daycares don't take kids for 12 hours. So you need a work environment that's going to work with your daycare schedule. You might need a Monday through Friday job because your kids have out-of-town soccer tournaments every weekend. And if you're working in a hospital, 12-hour shifts, and you have to work every other weekend, that's not going to work for you. So you have to look at your own personal situation as well. Make sense? You also have to look at things like, what kind of a people person are you? Do you like working with a team? Or are you more of a, give me my assignment, be there if I need help, but let me just do my stuff? Those are two totally different types of CNA work. If you don't work well with a team, a hospital is not your place. Does that make sense? Everybody with me? Are you looking for an opportunity for advancement? Are you just looking for a job right now to pay your bills? Or are you looking for something that'll allow you to move up and make it a career? Those are two totally different types of CNA work. You have to look at all of these factors to figure out the right place for you. Good? I know of a lot of CNAs that went into CNA class that thought, I'm going to be a hospital CNA. I've watched Grey's Anatomy. I know that's where Dr. McDreamy lives. That's where I'm going, right? And you decide, I'm going to be a hospital CNA, and yet you are horrible with change. That's not the place for you. Hospitals, you might start out with 6 patients. You end the shift, same shift, with 5 patients, and they're all different than the 6 you started with because we had admissions, discharges, and transfers. If you're not good with change, that environment not going to work for you. And what happens is you get into that environment and it doesn't work for you, and you think to yourself, healthcare is not for me. It's not healthcare that's not for you. You just picked the wrong place to do your healthcare. Does that make sense? So you have to kind of go into this with a little bit of understanding of what you're looking for. And I've made this quiz for you to help you identify this. It takes 5 minutes. It is 19 questions based on your personality and what you are looking for. And it's going to narrow it down to one of 9 different settings. And then it'll explain to you what your setting is and why. I think you would be a good fit for the hospital setting because you only have to work 3 days a week, 12-hour shifts, high, fast-paced environment, team-oriented, opportunity for advancement. It goes through everything. And if you read that and you're like, well, yeah, that sounds like me, but what other things are available? At the bottom, it shows you all of them. You can just go through and look at what the differences are between each setting. This is free. If you take this 5-minute investment, it can probably save you a couple of weeks of heartache. trying to figure this out on your own. And I have tested this with people that actually work in healthcare, thousands of people, and it is pretty accurate. I spent over 2 years developing that. There's a lot of psychology behind it. How do we know what to do with each patient? Follow the care plan. Every skill starts with an opening. Every opening starts with a knock. When do we need to use gloves? Body fluids, personal skin, non-intact skin. What's the first thing those gloves should touch? Patient. If we're going to use supplies, we need a clean place to put them. That's our barrier. If you're going to have your patient uncovered or undressed, they need a privacy blanket. Linens should never touch they should also not touch the floor. Where should the patient be at all times? Middle of the bed. If we're going to get water, we check it. They checks it. They check it. All basins are cleaned the same way. Rinse it, dry it, store it. Don't get involved in the details. It's fine. Rinse it, dry it, store it. Shoe rules. If you're going to put a gait belt on, it's got to be snug enough so that it doesn't fall off. So how do we check it? 4 fingers. Before you lift a patient, you count 2. And once you've lifted them, you find out if they are dizzy. Good. And then your closing, this is done at the end of every skill. Make sure your patient is covered, safe, and has a way of calling you. Okay. Pulse. Normal pulse rates between 60 and 100. Do not use your thumb to take a pulse count as long as care plan tells you to. Undress strong arm first when we're dressing a resident with a weak arm. Hand and nail care. You're going to wash the hand, rinse the hand, dry the hand, clean under the nails, file the rough edges, and lotion. That's it. Making an occupied bed, we change the sheets a half at a time using clean rolls toward me, dirty rolls away. Sideline position. Arm up, arm crossed, leg bent, leg angled, and then you just turn them on their side, prop them there with pillows. Foot care, just like hand and nail care, a little lower, no nails. So wash, rinse, dry, lotion. But what should we be doing while we're doing this? Yeah, looking, absolutely. Mouth care, brush their teeth, guys. Just make sure they're sitting up. That's it. Brush their teeth. Make sure they're sitting up. This is not a big skill. Pretty easy. Respirations, this is breathing. We don't want to tell them we're counting their breathing because it alters their breathing. Normals between 12 and 20. Range of motion. You're going to do exercises to retain what's already there. So we're not trying to make anything better. If we get to pain, the next one goes below the pain and we let the nurse know there was pain. Follow your care plan here. Your care plan is your recipe. It tells you what exercises, what body parts, and how many repetitions. Just follow that. Flexion, extension, up, down. Abduction, adduction, side to side. Rotation is around. Denture care, mouth care with an extra step. We clean the dentures in the sink. Make sure you protect them by putting a washcloth in the bottom. Use cold water. And then do mouth care. Ambulate with a gait belt. You want to pay attention to the patient. We're going to walk as far as care plan tells us to. We're going to use those shoe rules. But the whole big thing here is to pay attention to the patient. Partial bed bath. Don't cross-contaminate, guys. Use the leaves method with wet body openings. So this skill, face to waist, front and back, face first, no soap. That's really all you got to know about partial bed bath. Transfer a patient to wheelchair. This is pivot. They cannot take steps. So make sure that wheelchair is close enough to them. Make sure there's no obstacles. Get those leg rests and foot pedals out of the way so that they're not tripping over them. Right now, I'm actually, I'm going to time out for a second. I'm actually creating training videos for a home health aid course that I was contracted to do. And I'm using a program that has like stock footage, right? And I'm trying to use the stock footage to create these videos, and it's making me absolutely crazy. It's a lot of gray hair here because of this. So one of the stock videos that I was looking at yesterday when I was working on this is somebody taking a patient out of a wheelchair. And they the foot pedals are down, leg rests are forward, right? So they're sitting in the wheelchair, feet on the foot pedals. They took the feet off the foot pedals and put them on the floor in front of the foot pedals. Did not move the foot pedals. Just pick the feet up, put them on the floor in front of the wheelchair, and then help the patient stand. And in the video, you can actually see that patient kind of wobble a little and have to take a step, right? Those foot pedals should not be there. You don't try to get somebody to work around an obstacle. That's how falls happen. I was yelling at my computer all day yesterday. So make sure that all obstacles are removed. Feeding a patient is all about safety and socialization. Make sure they're sitting up straight, have a conversation, sit down and talk with them as you're feeding them. Don't feed them too quickly. Hairy care, top to bottom, never go back up. This is all infection control. We're going to use that leaves method because it's a wet body opening. So middle, side, skin fold, turn them on their side, and then clean the back side away from the urethra. Good? Questions? So that was 3 weeks of content distilled down into about 20 minutes. Am I going too fast for anybody? More importantly, am I going too slow for anybody? Would you like to see this whole course sped up to like 3 days? No? We're here for 8 days. You guys are already pretty nervous that graduation is like in 2 days, right? I could condense all of this information down into 3 days, but it's going to be rapid fire. Boom, 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 boom. Do you think you would get it all? No. And do you think you would be confident in the test? So I need you to understand that the way that I'm presenting the information is done in a way to help you retain it. And that's why I use a lot of repetition in my training. We've been putting up shorts just over like the last month. That's Jake's job. He cuts the videos down and puts up shorts. And some of them have got like hundreds of comments. Now, I don't normally go in there and look at the comments, but I did on one of them. People are mean. People are mean. And I'm used to that. I'm on YouTube and I get all kinds of comments there too. That's when I learned don't look at comments, right? But a lot of the comments were that I take too long to get to the point. And I do want to address that really quickly. I do take a while to get to the point, but I do it in a way that makes the point land. I want to make sure that you understand not just how to do something, but the why behind it, because that's what's going to make it stick. Otherwise, what would happen if I just told you this stuff, by the time you get out there and you start working, you stop paying attention to what the reason why you're doing it that way, and you start to create your own methods, and that's when our patients get into trouble. Does that make sense? Yeah, but yeah, I do take a while to get to the point. Oh, thank you.
Make it seem so like if you're like, by the time you do get to the point, you're like, oh, you know, like this makes perfect sense because of the way you explain it all, you know.
This is kind of the bane of my existence growing up. I was an only child. My mother tried really, really hard, and she's a wonderful woman. But my favorite word from the time I was 2 was not no. It was why. Why? Why? I drove her nuts because she didn't know why the sky is blue. I don't know. It's blue. Look up. It's blue. You know, I mean, she really had a hard time answering my whys. So she introduced me to the library and encyclopedias. And when I was 6, what I asked for my birthday, this is way before the internet, guys, was a set of encyclopedias. So I didn't have to go to the library to look up my whys. Okay. So my brain, I understand, is different than a lot of other brains. It's not wired the same. I have to know the why. And if I don't know the why, it doesn't make sense to me. So I give a lot of that to you. And yeah, I know I probably, in some cases, I go a little too far on that. It's just the way my brain is wired. I can't help that. But I do think that understanding that why makes it stick a little bit better. And you're less likely to adopt habits out there that are not going to serve you. Or more importantly, the patient. But yeah, I did. 6 years old, I asked for encyclopedias. I am weird. Weird. All right, so today is all about toileting. Last 3 skills, all about toileting. So we're going to start out with a bedpan. This is on page 147 of your book. We have all the principles down here. They're all spelled out for us here. We know them all. There's nothing new here to learn. We do need to learn our skill-specific steps. But let's go down here for a second. It shows test information. Somebody with your level of experience, which is none, should be able to help somebody with a bedpan in 10 minutes or less. But if you look next door to that, it tells you who we're going to be doing this on. A live testing student. That means that you guys might find yourselves sitting on a bedpan. Now, before everybody freaks out on me, I need you to understand that you're not actually going to use it. And you're not going to be undressed. For this skill, if you are a patient, you're going to stay fully clothed. They're going to give you a hospital gown to put on over your clothing. You stay fully clothed. The hospital gown goes over, you lay down in bed. This is a simulation skill. Yes, they will put a bedpan under your butt. They will take the bedpan out, but they're not actually going to be in your areas. Okay, good. That person will be positioned in bed, and this is not a documentation skill. Let's go to page 148. We have our care plan at the top. We've got some step-by-step instructions here, and then we've got our supplies at the bottom. Let me talk to you about supplies on this one. If you watch my old videos from 10 years ago, I do not use the overbed table for this skill. And that's because me personally, I do not like having a bedpan on an eating surface. That is where they eat lunch. I don't think a bedpan needs to be anywhere near their lunch table. Even with a barrier, that's pretty high on my gross meter. Okay. So if you watch my older videos, you'll see I do not use my overbed table. I just leave the bedpan in the drawer. It has a home. It's happy in its home. Leave it there. It's fine. Pull it out when you're ready for it. Put it right under their butt. It doesn't need to go anywhere in between, and that's fine. You can do it that way. But the newer videos, I use the table because I got a lot of comments on those older videos that, you know, every other skill, you pull out all of your supplies. This skill, you get your supplies as you need them, and it's confusing to me. So I simplified. I'm all about simplifying, guys. Made all skills the same. You will see me put a barrier on the table. You will see me put the bedpan on the barrier. I don't like it. It's okay. You can do that for the state exam. In fact, that's how the checklist is set up. But it doesn't mean you have to. Okay? Bedpans have a home. They're happy there. Let them stay there until you're ready for it. Now, another thing I want to tell you about this skill that makes it different from my old ones is the privacy blanket. Again, I hate this skill for a lot of reasons. But I hate this skill because it doesn't follow my rules on their grading processes. My rule is anytime your patient's uncovered or undressed, we use a privacy blanket. I think that's a good rule. And I think it's a particularly good rule when it comes to bedpan because when somebody is using a bedpan, it's going to get messy. There's no way around it. It's going to get messy. And this skill has our patients stay covered with a sheet throughout the the skill. That's a checkpoint. Covered with a sheet throughout the skill, not a privacy blanket. So you're not going to see a privacy blanket down here. You're not going to see a privacy blanket in the new videos. I don't like it. Because I can guarantee you that sheet is going to get icky and you're going to have to change a sheet at some point in a clinical setting. Use a privacy blanket. It's designed to be just that. Put on, use, taken off. But to keep this true to the testing checkpoints, we're not using a privacy blanket. And we are using a barrier on the table. Good? Good? All right, let's look at this care plan. It says the resident has requested a bedpan. The resident is not wearing undergarments and can wipe self. So for the exam, you, being a patient, are in bed with a gown on over your clothing. If somebody tries to take your pants off during the test, the evaluator is going to point to the care plan and say they're not wearing any undergarments. Don't take that off. Leave that alone. Okay? If somebody tries to get you cleaned up after you use the bedpan, the evaluator is going to say, stop, get out of there. That patient was able to wipe themselves. You do not need to be in their no-no square. Okay? Got it? So your patient doesn't have undergarments, is able to wipe self. So all we're doing here, guys, is putting a bedpan under them and taking it out. That's it. There's a couple things we need to know in order to do that, though. It says the resident is able to move as directed. Awesome. We can ask them to lift their hips and slide that bedpan right under. That's an awesome thing. We know all of the principles involved here. Nothing new to learn except our skill-specific steps. So let's get into those. All right. In order to understand a bedpan, we kind of have to go through toileting methods. As the nurse, this is one of the things that I'm assessing because I know at some point my patient is going to have to go to the bathroom. Everybody goes multiple times a day. This is high on my list. In fact, it's usually the first thing I'm looking at because chances are while I'm doing the assessment, they're probably going to have to go. Nerves. So the first question I ask myself is this patient continent? Can they hold it? Can they go when they need to go, right? Are they continent? If the answer is no, that's easy. They're incontinent. Pericare every 2 hours. We've already learned that. Easy. But if they are continent, now I got a lot of work to do here. I got to figure this out. So if we have a continent patient, my next question is, can they get up and go to the bathroom? That's my goal. If this patient can get out of bed and get themselves to the bathroom and go on the toilet, oh, my life is awesome. Okay? I am not involved in that process. We are both very happy with that. This is called bathroom privileges, or BRP, on your medical abbreviations list. Bathroom privileges. Bathroom privileges just means your patient can go as they need to go, just like you. You guys can all, right now, get up and go to the bathroom without me being involved. Please don't involve me. Do what you need to do. Bathroom privileges. Now, it may say bathroom with assist. Means they can go to the bathroom, they just need a little help. Either getting there, getting back, in there, I don't know. Bathroom with assist. But if they can't get to the bathroom, if that's not a possibility, too far, they're too weak, they have way too many tubes and things they're attached to, now we have to look at another alternative, and that is a bedside commode. Looks like this. It's a portable toilet. I bring it to the side of the bed, and the patient gets out of bed and onto the commode and uses it like a toilet. It kind of actually looks a little bit like a toilet. CNAs empty these and clean them. This could be with or without assist. Now, if they can't get to the bathroom and for whatever reason they can't get out of bed to use a bedside commode, I've only got two options left. I have catheter and I have bedpan. That's it. That's all that's left here. So catheters are only used if a patient's pee cannot come out on its own, or if the pee that comes out isn't convenient. Okay. So let's say that we have somebody who has a huge bed sore on their backside, huge, all the way down to the bone. I don't want that patient laying in urine because remember, urine is acidic. Acidic urine eats skin. I've got open skin, not a good situation. That would be a good call for a catheter. We also use catheters during surgery because when we put you to sleep in surgery, we put everything to sleep, including that valve. So whatever urine is in the bladder is not going to be in the bladder very long. It's going to come out. Not convenient when you're laying on a sterile field. So we usually put a catheter in for surgeries so that you're not peeing all over the surgical team. Make sense? So there are situations where a catheter is indicated, but we don't use catheters the same way we used to. And I'll talk to you about that in just a few minutes on the next skill. We don't use catheters the way we used to. These are actually pretty rare now. So the last thing that I have on my list, look at how much I had to go through. The last thing I have on my list is that bedpan. Did you notice bedpan was not the first? It is the last. Bedpans are a last resort. And there's a couple of reasons for that. First, it's not comfortable for the patient. They're just not comfortable. But the real problem here, like everything else, is psychology. Psychology really messes us up, people. When you have a patient in bed and you put a bedpan under them, their brain was trained from the time they were this tall. Do you guys remember learning that memories that we make when we're young are the ones that stick? We've been trained from the time we were this tall, don't pee in the bed. Don't pee in the bed. Don't pee in the bed, and certainly don't poop in the bed. I mean, come on. So when we put a plastic pan underneath your butt, doesn't mean your brain is going to let you pee in the bed. And these patients often require multiple tries. We put a bedpan under them, they can't go. We take it out. A couple hours later, they say, I got to try again. We put a bedpan under them, they can't go. We take it out. And this can go on 3 or 4 times before your patient's finally able to use the bedpan. And even still, they're going to be fighting it the whole time. So we're not going to get a complete empty. Does that make sense? So psychologically, this is a very hard thing. I'm going to give you some tricks to use to help these patients. But bedpans really are a last resort. So our care plan specifically says the resident is able to move as directed. Yay. We can ask our patient to bend their knees, put their feet flat on the bed, and lift their hips, that bridge position, and slide the bedpan underneath. Yay, that's awesome. But what if your patient can't? Well, this patient can. Our care plan says this patient can. So for the test, use the gift they give you. Have them lift their hips. Makes it easy. But if a patient can't do that, if they can't lift their hips, we're going to turn them on their side, put the bedpan up against their butt, and roll them back on top of the bedpan. But when you got to take that bedpan out from under the patient, you better hold it flat. Because when you've got a bedpan and you've got a patient, when they roll, so does the bedpan. And whatever's in that bedpan is going to go everywhere. Okay. So when you have a patient roll off of a bedpan, you hold the edge of that bedpan flat as they roll off of it and then take it away. Good. Way easier to have them lift. Way easier. Take the gift they give you. Now, with all of this moving around, whatever's in that bedpan is probably going to spill. So what could we put on the bed that's absorbent and waterproof to help protect the sheets? A chucks, an underpad, absolutely. And we're going to use that whole clean rolls toward me, dirty rolls away. We already know how to do this. Nothing new to see here. We have the patient lift their hips and we unroll a clean chucks under them. And then we position the bedpan on the chucks. Now, when we put the bedpan on the chucks, we want to put it in the right way. This is a graded checkpoint, okay? So, this is a bedpan. This looks like a toilet seat. it's where the butt goes. Can you imagine sitting on this? Yeah, this is not comfortable. If it looks like a toilet seat, it's where the butt goes. The fact that this is a tested checkpoint tells you that there are a lot of people that put this end under the butt. Okay, good. Okay, so you want to put it under the backside. Now, when you do that, understand mechanics here. I'm going to pass this around so you guys can all see what a bedpan looks like. There's some mechanics here we have to talk about. And in order to understand the mechanics, I got to go to the next slide real quick, but I want you to kind of pay attention to where this bedpan is being placed. When you okay. Little visual goes a long way here. When you have a patient laying in bed and you put a bedpan underneath your patient's middle, what does it do to their middle? Raises it up. How many of you ladies can pee uphill? That's what we're asking this patient to do. We are asking them to pee uphill. Now, if you think peeing uphill is hard, try having a bowel movement uphill. Not going to be effective. So that means that when we put a bedpan under the patient, this is not an effective elimination position. We need to get them into a normal elimination position, which is sitting. So we are going to put the head of the bed up. This is the most important step of using a bedpan. It's the head of the bed. The most important step. This is the one that is going to weigh the most on this scale. Because if you don't, if you leave that patient flat, they're not going to be effective, or way worse, if they are, that pee runs right up their back and into their hair. And that's pretty high on everyone's gross meter. So putting the head of the bed up isn't just a step. It is the most important step. But that means that the head of the bed is going to bend, right? So we have a bed that's flat. When we put the bedpan in place, we put the head of the bed up. But the area, that pivot joint where that mattress bends, is the same bend point of the patient, their butt. So when let's go back, when we put the bedpan underneath their bottom, understand that we're about to put the head of the bed up, which means that bedpan is either going to shift back or it's going to shift forward because it's right on the part of the mattress that is about to bend. It is better for this to shift forward rather than backward. So when you're putting this bedpan under the patient, when you're positioning it, you want to position it just a little bit forward of center. Does that make sense? Little bit forward of center. All right. So we know that we have to put the head of the bed up so our patient isn't trying to pee uphill. But we have just put a chucks underneath our patient's bare bottom. Remember, our care plan said the patient is not wearing undergarments, right? We've got a bare butt. Are you going to put your bare hands under a bare butt? What do you need? Gloves. So you've just put a chucks under a bare butt and a bedpan under a bare butt with gloves. That means you have butt juice gloves. Do you want to touch this bed controller with butt juice gloves? No. What do we need to do before we put the head of the bed up? Take the gloves off. So we put gloves on, we put our barrier in place, we put our bedpan over the barrier, we take our gloves off and put the head of the bed up. Good? Good? All right. Then we've got to give them what they need. Toilet paper and a call light. Toilet paper, because our care plan said they can wipe themselves. Thank you. Awesome. Let me give that to you because I don't want to be in there. I also need to give them a call light to let me know when they're done so that I can come back in and help them get off of the bedpan. Good? Good? All right. So we're going to give them what they need. When we come back, so let's talk about that. For the test, how many patients do you have? One. You are in one room with a door. One patient. There's nowhere to go. So for the test, you're going to put the chucks under the patient, put the bedpan under the patient, take your gloves off, put the head of the bed up, give them their call light, give them the toilet paper, and there's nowhere for you to go. So you don't need to wash your hands. You're not leaving the room. You're simply going to step on the other side of the curtain and you're going to wait. They're going to say pretty quick, I'm done. And you're going to come back and you're going to put the head of the bed back down, put your gloves on, take the bedpan away, and go clean it. That's bedpan. Good? Make sense? But in a clinical setting, we are not doing that. We are not doing that because patients have a hard enough time going in bed. If they've got somebody standing on the other side of the curtain waiting for them, they're going to feel some pressure. Do you know what that's going to do? It's going to kill their ability to go. They just will literally tighten up. Nothing's coming out. That's not good for them. It also is kind of a privacy violation. Does that make sense? So in a clinical setting, when you get your patient all set up, we are going to wash our hands and we are going to leave the room and go take care of somebody else. Go do something else. When they hit the call light, then you can come back, wash your hands, and finish up. Don't just stand there and wait. That's just not good for anybody. But for the test, we don't have that luxury. We have to stand there because we don't have anywhere else to go. So do you understand there's a difference between test and clinical setting here? For the test, we're not going to wash our hands. We're not going to go anywhere. We're just going to stand and wait. In a clinical setting, you are going to wash your hands. You are going to go somewhere else and come back when the call light goes off. Make sense? Good. All right, so we're going to put our head of the bed back down. We're going to put our gloves on, and then we're going to take the bedpan and the chucks together. I'm also going to tell you this is another issue with doing this for the test, because in a clinical setting, let me see that bedpan real quick. Let me show you something. Thank you. All right. Here's our problem. This is a bedpan. You guys see how much room is in here, right? We have a body that is sitting in here, and that body is going to sag down into this cavity. So the undercarriage of the body is not this far from the bottom. It's only about this far from the bottom. We have urine under pressure hitting a flat plastic surface that's only about this far away. They're going to get splashback. No way around it. There's going to be splashback. So a patient using a bedpan is going to be pretty messy underneath. Now, that's complicated by the fact that in order for them to clean themselves up, they've got to be able to get a hand with toilet paper inside here, avoiding the contents of the bedpan and in a place that they can reach their undercarriage. Do you think they're going to be all that successful? Probably not. So our care plan is telling us our patient's going to take care of it. That's awesome, but that is fantasy land. Okay? So I need you to understand that everything that I'm about to tell you from this point on is based on the test, not real life. We're going to talk about real life after we talk about the test, but let's get through the test first. Do you guys understand that? Good? Okay. So for the test, we are going to take the chucks and the bedpan out together, the whole thing. Everything comes out. We're going to fold that chucks over the bedpan because we cannot carry an open container of urine through a room. Jake, door. We cannot take an open container of urine through a room. If my shoelaces come untied and I trip, where am I going to go? That's pretty gross on everybody's gross meter, right? So you can't carry an open container of urine through a room. It's an infection control problem, but it's also a privacy issue because nobody needs to see what's in here. That's just a privacy issue. So to get around that, we're going to take the chucks and the bedpan together and wrap that chucks over the bedpan. It covers it. It keeps it private, but it also keeps us from having to interact with it accidentally. Make sense? I told you there's a difference between test and real life, though. In real life, your patient probably has not cleaned their undercarriage all that well. Right? It's in here. It's not going to be all that clean. If you take that chucks away, now their dirty undercarriage is right on their sheet, and that's a problem. So in a clinical setting, the way I would handle this is I would have 2 chucks under the patient. One that comes out with my bedpan for me, one that stays on the bed for the patient until I can help them get cleaned up.
In that aspect, like when you first put the chucks on the bed, would you just stack them on top of each other?
Mhm.
If we did that in the exam, would they deem it? Or
They're going to yeah. So the question is, in a clinical setting, if we're using 2 chucks, do we stack them one on top of each other? And for the exam, just use one. Just use one. In a clinical setting, yes, I would use 2. And the way that I would stack them is not directly on top of each other. I would have them just a little bit offset with the one I'm going to take off of the bed down a little bit. Okay, down a little bit, like more toward the knee, not in the knee, but below. The one on the bottom would be a little bit higher. That way, when I'm taking them away, they won't interact with each other too much. Okay, so the next question was, can we just use 2 for the exam? And the answer is no, don't do that. There's a reason for that. First of all, the testing center has to buy these supplies. And we're going to throw these supplies away. So during the test, they're probably not going to want you to use a whole lot more supplies than you actually need because they're expensive. Okay. Does that make sense? Does that help? So, and this is simulation. We don't actually have a dirty butt that's going to be laying on the sheet, so it's not a big deal. But I do want you to understand the logistical differences here, that during the test, our patient really didn't go. 1 chucks is fine. But in a clinical setting, you need a chucks to wrap around the bedpan, but you also need to leave something on the bed. You could use a towel as well, and that would be fine. Okay. Does that make sense? Good. But don't carry an open container of urine anywhere. Okay. So we've wrapped our chucks around our bedpan and we're going to take it to the bathroom area. Once we get it to the bathroom area, we're going to throw our chucks away, dump our contents in the bedside commode, but there's not actually going to, it's empty. We're pretending. There's not actually anything in here. In a clinical setting, though, when you're dumping a bedpan, you probably want to look. Is there something there that we need to notice? For instance, if the urine is purple, that probably needs to be reported to. And that does happen. There is a medication that can turn the urine purple. There are a bacterial contamination. If your urine is very sweet smelling, like maple syrup, like really sweet smelling, that is an observation. Who needs to know that? The nurse. If we only have 3 drops of urine and the patient was on here for 20 minutes, That is an observation. Who needs to know that? The nurse. So take a look. Okay, good. Okay. So we dump our urine, which for the test is going to be nothing. It's an empty container in the toilet or the bedside commode. We're going to rinse out our bedpan. We're going to set it down, pick it up with a paper towel, dry the inside, dry the outside, grab one more for the drawer. We'll grab the toilet paper on the way, put our bedpan and our toilet paper away, throw our paper towels away and remove our gloves. Good? Good? Okay. All right, let's talk about bedpan cleaners. I can't put that there. Let's talk about bedpan cleaners. So if you go to an acute care setting like a hospital or a rehab, a lot of times you'll see this on their toilets. This is actually a hospital bathroom that I took a picture of when my mom was in the hospital. And you can see that the pipes, it's not like a regular house toilet that has a tank here. It's like exposed pipes. When you have this exposed pipe, look for something that looks like a little shower head right in front of it. When you bend this forward, it literally pivots like this over the toilet. When you bend this forward, sometimes it'll start to spray automatically. Other times you have to hit the flusher. They're plumbed a little bit differently. But when you bring this forward, it'll center itself right over this toilet and it'll start to spray. You use this as a bedpan cleaner. It literally cleans the bedpan right over the toilet. So now we're not in the sink where they brush their teeth, which I think is an awesome thing. There's a problem with this. We have water under pressure hitting a flat plastic surface. We will have splashback. That means that you run the risk of getting particles on your clothing or into one of your doorways. So if we're going to use a bedpan cleaner, we do need to dress for the job. You want to put an isolation gown over your clothing so that we don't contaminate our clothing. Remember, we're going to be walking a patient later. We're going to be transferring a patient later. We're going to be feeding a patient later. We don't want to be walking around with, waste products on our clothes. So put an isolation gown over your clothing, and then you want to protect your face with a mask and shield. It's not going to help with odor. Masks do not help with odor. They don't. But they do help keep waste products out of your holes. Now, if you're particularly sensitive to odors, the old school way was to get Vicks Vapor Rub, the stuff that mom used to put on your chest, and you just put it right under your nose. I don't like that because the menthol turns me Rudolph red, right? My nose will look Rudolph red in a very few minutes. So I used to go get Vaseline, the little tiny containers of Vaseline, like purse-sized containers. I'd put a couple of drops of essential oils. I like orange blossom or lemongrass in there, mix it up, and that was my odor killer. Now, I just saw this on Facebook like 2 months ago. Someone is going to make a fortune on this, and I really wish it had been me. They now have little rings. They're plastic rings. Yes, and they have like little balls on the opening, right? And you just put it right in the septum of your nose. It doesn't pierce. It just sits there, and it brings the essential oil smell, and they can be used for like a couple weeks. You just keep the pouch. You put it in your pouch when you're not using it, close it up, and it'll stay fresh for a couple weeks. It is amazing. And like I said, such a simple idea. What a simple idea. And these people are going to make a fortune off the healthcare industry. Do they work? So, but remember that masks don't really do a whole lot for odor. So these are some other options for you. Good? Good. Isn't that amazing? Really wish I'd come up with that idea. Okay. So we have a patient who has used a bedpan, did wipe themselves. How do I know they wiped themselves? Because care plan, and I didn't do it. That's right. So I know where their hands have been. They can't get up and go to the bathroom. If they could get up and go wash their hands, they wouldn't have been using a bedpan, right? They're stuck in bed. So if I know where their hands have been, what do I need to give them? Yeah, something to clean those hands. Absolutely. So we're going to give them a hand wipe. Now, the test doesn't care whether you give them the hand wipe before or after you take your gloves off. Students get all wrapped up in this. Nobody cares. I do. Because I'm going to touch that hand wipe before I feed them later. Do I want my urine covered gloves all over that hand wipe container? No, it's just not cool. So I'm going to take my gloves off before I give them the hand wipe. But I know some of you are going, but wait. I know where their hands have been. And now I got to get that hand wipe from them. I don't want to touch that hand wipe. I know where their hands have been. And I'm with you on that. But what could I get between my hands and that dirty wipe? A paper towel. So I'm just going to grab a paper. I'll give them the hand wipe, grab a paper towel. I'm going to collect the hand wipe with a paper towel and throw it away. Do my closing. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Magazine. Here's your call light. Environment's clean. Are you comfortable? Awesome. Now, if they want the head of the bed back up because they want to read, that's fine. I can do that for them. If they want to stay back down so they can sleep, that's fine. I can do that for them. I'm just going to ask, are you comfortable? I'm going to remove that blanket and put it in dirty linen. I'm going to open the curtain and then I'll go wash my hands. Good. Oh, yeah, I'm sorry. Yes, thank you. This is the old. Yes, you're absolutely right. We didn't use a privacy blanket for this one. Thank you. Again, this is I have a hard time with this, right? So you're just going to keep the sheet on them. You're not going to have a privacy blanket to work with. No, not for the test because they didn't really go. In a clinical setting, I'm using a privacy blanket. I am not using their sheet because chances are with all of this stuff going on, that sheet's going to get dirty. Hey, Jake, do me a favor. Make me a note. Slide 52, bedpan, or class 7, slide 52, remove privacy blanket. Thank you. This is the old image. All right, any questions on that? Any questions? We now know all of the steps for this. Let's put it together. Here's our checklist. We're going to follow our care plan. We're going to go back here for a second. This skill is to help a patient with a bedpan, right? And our care plan says that the patient needs a bedpan. They're in bed. There are people who take the test that do not understand what a care plan is. There are people who take the test who read that care plan or hear it, and they think to themselves, well, I'll just get the patient up and take them to the bathroom. This patient needs to go to the bathroom. I'm going to take them to the bathroom. That seems like a very reasonable assumption, except our care plan doesn't tell us to do that. So that's why this is actually a graded checkpoint. Are you following the care plan? Good. If you get the patient out of bed and try to take them to the bathroom, you're going to fail the skill because you're not following the care plan. Now, some students would say, but why? Why can't I just take the, I mean, that's a better place for them to go. Well, if they've got a broken hip, you getting them out of bed to take them to the bathroom can cause injury. Does that make sense? If they just had a heart cath done and they have to remain flat on their back for 6 hours, if you put the head of the bed up, you run the risk of a CSF or cerebral spinal fluid leak. Good. We have to follow the care plan. I'm sorry, not cardiac cath. If they had a spinal tap, sorry. If they had a spinal tap, they have to remain flat. If they've had a cardiac cath, they also have to remain flat with pressure on that artery. So we don't know everything there is to know about these patients, and that's why we're responsible for following that care plan. Good? All right, we're going to do our opening and get those check marks. We're going to wear gloves. Yes, yes, yes. Body fluids. We're not going to take a break yet. We're going to use a barrier on our table. Patient needs to be in the middle of the bed. We're going to clean our basin the way we clean all basins. We're going to use our bedpan specific steps, and we're going to do our closing. And by doing those things, we get all of these check marks checked off. Now, this is one where the skill steps are about equal to the principal steps. You kind of have to know them both. But this care plan is only for this patient. This one gets up and goes to the bathroom by themselves. This one uses a bedside commode. This one has a catheter. Every patient's going to be a little different. Good? Questions? Let's watch the video on this.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I understand you need a bedpan. Can I help you with that?
Yes, please.
Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. After I've washed my hands, I'm going to get my supplies. I'll start with a barrier, unfolding it with the absorbent side facing up, and this is going to give me a clean place to put my clean supplies. And we're going to start with the chucks, and then I'll move over here to the patient environment. I need a set of gloves, a second set of gloves, hand wipes, and I'll need the bedpan, which will be in the bottom drawer. I'm going to open the drawer, but I'm not going to touch the bedpan until I put my gloves on. We'll go ahead and put the gloves on. I'll take the barrier and prepare it by holding it up with the absorbent side facing me, and I'm going to roll it toward me. And we're going to set that aside. I'll get the bedpan and the toilet paper out of the drawer, and we'll put those on the bedside table. Now we're ready to start the skill. Okay, Mr. Jones, I'm going to ask you in just a moment to bend your knees and put your feet flat on the bed, and you're going to lift your hips up for me so I can unroll this chucks underneath you. This is going to protect your bedding while you use the bedpan. Okay? So I'm just going to loosen this sheet up a little bit so we've got some working room. I'll take my prepared chucks, and we're going to place it on the bed where we're going to unroll it under the patient. It needs to be under the middle of the patient where the bedpan is going to go to protect the sheets from becoming soiled. Mr. Jones, can you bend your knees? And I want you to lift your hips as high as you can go. Thank you. I'll unroll that chucks all the way to the other end. Okay, you can relax. There you go. Now we're going to put the bedpan under the patient. The wider end of the bedpan goes under the patient's buttocks. So this will be toward the foot of the bed. Mr. Jones, can you lift for me? Thank you. Go ahead and come down. Make sure that that's centered appropriately. All right. And now I can remove this set of gloves. We'll throw these gloves away, and I'm going to put the head of the bed up. Mr. Jones, I'll put the head of the bed up now. That bedpan may shift a little bit. Feel free to move it as you need to and let me know when you're comfortable. And you can relax your legs. So you comfortable? Okay. Here's your toilet paper. Here's your call light. I'm just going to step on the other side of the curtain and let me know when you're done. Okay, Mr. Jones, are you done?
I am.
Very good. Let me lower the head of the bed. There we go. And I'm going to put my gloves on. All right, Mr. Jones, in just a moment, I'm going to ask you to bend your knees and lift your hips off of the bedpan. But wait until I tell you because I need to hold that bedpan flat.
Okay.
Okay? I'm just going to move this out of the way. I'll take a corner of the chucks. Go ahead and bend your knees. Don't lift yet. I'm going to take a corner of the chucks and hold the front of that bedpan down as he lifts. Go ahead and lift. And I'll pull the whole chucks and bedpan out. Relax. And we're going to take this to the bathroom for disposal. I'll bring the bedpan over to the patient bathroom area. We'll unwrap the chucks from around the bedpan and dispose of the chucks. And then we're going to dispose of the contents of the bedpan into the bedside commode. For testing, this is a simulation skill. There will not be anything in the bedpan, but we're still going to follow through with the simulation. We'll lift up both the seat and the lid. We're going to dispose of the contents of the bedpan into the bedside commode or toilet. And then we're going to rinse the bedpan. We want to put the rinse water into the commode as well. Now I'm going to set the bedpan down into the sink, disinfect it per facility policy, and then use a paper towel to pick it up. I'll take a paper towel to dry the inside. Throw that away. Another paper towel to dry the outside. Throw that away. And then one more for the drawer. Now that I've cleaned the bedpan, I'll get the toilet paper, place it in the bedpan, open the drawer with a paper towel, and then we're going to position this bedpan in the drawer and close the drawer with the paper towels. I'll then throw these paper towels away. We're going to remove the gloves and throw those away. I'll get a paper towel. Mr. Jones, I'm going to give you a hand wipe so you can wash your hands after using the bedpan. Go ahead and take a hand wipe. And then I'll collect that hand wipe after you're done with the paper towel.
Thank you.
This keeps me from touching the hand wipe. We'll throw this away. We're going to throw the barrier away. Clean our work environment. So I'll pull the sheet up. Make sure that it looks good. And here's your call light, Mr. Jones. If you need anything at all, just press that red button and we'll be happy to come back and help you. I'm going to remove your bedside table and open your privacy curtain. Is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Would you like a magazine before I go?
No, thank you.
Okay, your bed is in the low position. Your environment is clean. I'm going to go wash my hands. After washing my hands, I'll review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done. All right, any questions on that? Any questions? Bedpan is actually one of the easier skills. It is a little bit of a longer skill, but it does, once you understand the principles of it, it's really kind of an easy skill. I'd much rather do bedpan than dentures. All right, let's go ahead and take our break. When we get back, we have 2 skills to learn, and I'm going to present them one right after the other, and then I'll show you both videos back to back because these 2 tend to go together. They're 2 separate skills for the state exam, but they have a lot in common. Okay, so let's go ahead and take our break. together, and then we'll show you.
Patty, would you like to reset? You were muted.
Oh, I was muted, sorry. Okay, so the next two skills are catheter care and drainage bag. I'm going to do both lectures together because they are very, very similar. And then we'll watch both videos together, and then you should have some practice time at the end of class today. All right, so if you go to page 158, we have all of the principles involved in this skill. They're all spelled out for us here. Our skill-specific steps are here. This is our test information. Somebody with your level of experience should be able to do this in 15 minutes or less. This is a mannequin skill, just like pericare. In fact, this is pericare with an extra step. So it's, you already know half of this skill. All right, page 159 tells us our care plan at the top, step-by-step instructions. Our supplies are along the bottom. Let's take a look at this care plan. It says provide catheter care with soap and water to a female resident with an indwelling urinary catheter, clean the catheter tubing and perineal area only. So we're cleaning the tubing and the peri area. Doesn't matter which one you do first, tubing or peri area. You just have to get them both done. So if you remember pericare, we changed the chucks because they were on a wet chucks. We cleaned the peri area, top to bottom, middle, side, skin fold. We rinsed and dried. We turned the patient over. We cleaned the back side, up the center, one cheek, the other cheek, up the center. And then we changed that chucks again. So we left them on a clean pad. This was pericare. Catheter care is similar with a few small differences. We're not going to leave, the patient isn't going to start out on a pad. So we're not going to change it, but we are going to put one there to keep our sheets dry while we're cleaning them. So instead of changing, we're just going to put a chucks there. We're going to clean the peri area just like we clean everything else. We're going to clean the catheter, moving away from the body. We're not going to clean the backside. With pericare, the whole reason we had to clean the backside is because that backside was laying on a wet pad. We had urine against the skin. So we need to wash that urine off. With a catheter, the urine is in the tubing in the bag. The patient's not laying on it. So we don't have to clean the backside. So clean the peri area, clean the tubing, and then we'll remove that pad out from under the patient. We don't leave a patient underneath somebody if they don't need it. Those pads are going to hold in body heat, which is going to make the patient sweat. And now we have warm, dark, moist, no good. So if we don't need a pad under them, there's no benefit to putting one in place. So for this skill, we'll put the pad in place while we're cleaning, but we're going to take it away. We're also not going to clean the backside. No need. Good? Jake? Oh. Okay. So we need to talk a little bit about catheters, what they are, how they work, and who actually puts them in and takes them out. So CNAs do not put catheters in. That's not your role. CNAs don't take catheters out usually. Now, you can be trained to take a catheter out. It is possible in some settings if that's necessary. But for the most part, nurses are going to be the ones that take them out. So nurses put them in, and nurses, for the most part, take them out. Good? Good? Okay. This is what a catheter looks like. Catheter is a straw. That's it. It is a straw. Just like a straw allows you to take liquid from a cup up to your mouth, this straw takes liquid from the bladder to a bag. That's all it does. It just confines and moves liquid from one place to another. All a catheter is. And like a straw, like this straw specifically, it is flexible. Catheters are flexible. Jake, I am missing a drainage bag.
I believe it's attached to the bed on the far side.
Okay. All right. Give me just a second, guys, and I'm going to show you how a catheter works and let you play with one so you're not afraid of them. Sorry about that. Okay, so catheters and bags are two separate pieces. We're about to see that in just a minute. And they are joined together by simply plugging one into the other, just like that. So this is a catheter, and this is the bag, okay? Just like what you see here. Catheter plugs into the bag. Good? Now, if you look at this catheter, you can see there's a balloon there. This one, the balloon is deflated. When I put a catheter in, the balloon is deflated. Once I get it in place, if I don't have any way for it to stay in there, if I let it go, it'll fall right out. That's not going to do anybody any good. So when we put a catheter into place and we advance it beyond that valve, remember that valve we learned about? Then we take some sterile water or normal saline and we inflate a little balloon on the end, and that keeps it from coming out. Acts as like a little doorstop. You can see that there. It just sits right on top of the valve and keeps it from coming through. Now, if I pulled on this hard enough, it'll come out. It's squishy. No, it's a balloon. It's a water balloon. It's squishy. So I can pull this out, and that's going to tear the tissue because we got a balloon this big going through space that big. It's going to tear the tissue, but it's not life-threatening. Your patient's okay. It's just going to sting a little bit for a while. Good? Good? You guys understand how catheters work? That's all they are. They are flexible straws. So the catheter is smooth when it's inserted. Once we get it into place, we inflate that balloon using sterile water through this port. It blows up that balloon, and then it just sits right there. Keeps it from being pulled out easily. To remove the catheter, well, we would just deflate the balloon, and then it's going to slide out like a piece of spaghetti. This is why we can train CNAs to take catheters out. Because you simply take a syringe, you pull the water out, and it slides out. Now, you cannot remove catheters until you've been trained to do so. So if a nurse says, hey, will you please go remove that catheter? The patient's getting ready to go home. If you haven't been trained, what's your answer? No, I haven't been trained. But if you have been trained and the nurse says, can you please go remove that catheter? The patient's being discharged. That's perfectly acceptable for you to do. Now, most states, rightfully so, do not allow CNAs to put catheters in because there's a high rate of infection when this is not done through sterile process. And sterile process is not usually something that a CNA is tasked with doing. So CNAs don't put catheters in, but with additional training, you can be trained to take them out. Good? Does that help kind of demystify catheters a little bit, make them a little less scary? They're straws. That's all they are. They're straws. All right, so what do CNAs do with catheters then? If we don't put them in and we don't take them out, what are we supposed to do with them? Well, we keep them clean. That's our job. We keep the catheter and the skin around it clean. We also empty the drainage bags. Now, this is going to be done usually once a shift. How often do we have to do pericare? Anybody remember?
Every 2 hours.
Every 2 hours around the clock. This is only done once a shift. So when your patient has a catheter, it's a lot less work on us. Good? Let's talk about bags. CNAs also have to inspect the bag. The bag should never be on the floor. What's the only thing allowed on the floor? Shoes. So bags should never touch the floor. Bags also should never go above the level of the patient's hips. We also need to make sure that the tubing itself is not kinked and not coiled near the floor where somebody can get their foot caught in it and trip. All right, so let's look at all the pieces of a catheter. This looks way more complex than it is. Here it is right here. All these numbers make it look a whole lot more complex than it is. It's not bad. So at the very top, we have the tip of the catheter that has a hole in it. Now that hole, all it does is it allows urine to go inside the straw. Just like this straw has a hole on top, this straw has a hole on the sides. That's it. That's the only difference. You have the balloon that is inflated to keep the catheter in place, deflated when we put it in and take it out. You have the actual catheter tubing itself. That's just tubing. It's a straw. Down here, you have two ports. One of them allows us to put water into the balloon and take the water out. The other port attaches to the bag. Then you've got the tubing for the bag. Then you've got the bag itself. The bag has markings on it that we don't use. This is not how we measure urine. It's not scientific enough. It's good for a rough estimate for nurses. We have a port where we empty the bag, and then that port has a little house where it lives. So these are all of the parts of the catheter. I'm going to pass this around so you guys can play with it. You can put water into the balloon, take water out. You can plug this in if you want to. You can look at the bag and the emptying port, which we're going to get into this in more detail in a little while. So I'll be passing this around again when we get to that point. But this allows you to kind of get some hands-on practice with catheters and bags. If you get a practice kit, there is a bag in the practice kit for you guys to be able to use and play with. I do not give you catheters, though. Nope, not going to give you a catheter. So that's why I pass this around, because this is the only place that you can actually play with a catheter. Catheters and bags are two separate pieces. They have to be that way because a catheter can stay in place for up to 30 days before it has to be switched out, but bags are generally switched out once a week. So because we switch out the bag more often, they have to be two separate pieces. CNAs do not switch out the bag without additional training. Very important. You do not switch the bag without additional training. So what we do is clean the catheter. We clean the skin around the catheter. We empty the bag, but we don't switch out the bag unless you've been trained to do so. It's really easy. They just literally plug into one another or unplug. It's not a hard thing. The problem is that if we allow bacteria in when we switch that bacteria does not have far to go to get into the patient. And that's a risk for the patient. So this is not hard. It's not complex. I can teach somebody to do it in about 3 minutes. Teaching them how to do it without contaminating takes a little bit longer. Okay. Good? All right. So this is our biggest risk. You guys remember this from class 2? Catheter acquired urinary tract infections called CAUTIs, CAUTIs. These are the most common healthcare acquired infections. So we talked a little bit about healthcare acquired infections. These are things that when you go into a healthcare setting, you don't have, but you get while you're there, kind of like a bonus gift, means we did something wrong. Okay. We introduced a pathogen where the patient didn't have one before. This is one of the most common types of healthcare acquired infections. So when a patient has a catheter, they're really at risk. And the reason is we have a doorway that is always open. Always open. Remember our doorway for pathogens to get in? A catheter is an always open door. That's a problem for our patient. Now, that always open door is leading to a bag. The bag is closed. That's a good thing, but the bag isn't permanently closed. We open it to empty it. So if we allow pathogens into the bag and those pathogens climb up the tube and climb up the catheter, that's an open door for them to get into the bladder. Now, bladders, warm, dark, moist, all you can eat buffet. So there's enzymes and proteins in the urine that allow the pathogens to procreate quickly and easily. Now, pathogens don't need little boy pathogens, little girl pathogens, have baby pathogens. They just need the right conditions and the right food sources. And they zip themselves in half, and now there's 2. That's it. That's all that's required. So if we start out with one little lonely pathogen and we give it the right environment, that 1 becomes 2. That 2 becomes 4, 8, 16, 32, 64, 128, 256, and it just exponentially ramps up. So you can have a patient that can become very, very ill very, very quickly because as those pathogens multiply and climb and they get out of the catheter and into the bladder, it's not 1 or 2 pathogens that are invading. It's 1 or 2 trillion. And this patient goes from I'm okay to I am really, really not okay, like that, because that invasion is just so overwhelming. It overwhelms patients' defenses. Does that make sense? So as CNAs, that's why we do not put catheters in and you have to be trained to change them. But it's also why when we empty the bag, we have to be super careful not to allow pathogens into the bag. This is why we change the bag once a week. Because if a pathogen got into the bag and climbed the tubing, it probably didn't get all the way to the catheter.
By change the bag, you mean as you replace it as opposed to not to empty it, right?
Right, replace it. Emptying the bag is a skill that we're going to learn in just a minute. Replace it, change it, okay, change it out, means to provide a new one, and that removes the bacterial risk. Good? Do you guys remember this? Urinary system, we have 2 kidneys, we have ureters. Urine drips down the ureters, collects in the bladder. We have a valve at the bottom of the bladder leading to the urethra, which is our gate outside. When we have a catheter, this whole system still works exactly the same. Kidneys still filter blood, still produces urine. That urine still goes down tubes, still goes into the bladder. Nothing has changed. What has changed is we put in a doorstop. We just held that valve open with our catheter, and we are allowing the urine to go down through the catheter instead of the urethra. That's all we're doing with a catheter. We're artificially emptying the bladder by holding that valve open and diverting the urine into the catheter. Good? That's all a catheter is. So because the urine does flow freely into a out of the catheter, we have to attach it to some sort of a collection device. Otherwise, if we just put a catheter in, all of that urine is just going to come out of this hole and go everywhere. That doesn't really help anything. So when we have a catheter in, we always have it attached to some sort of a collection device, a bag. There's a couple of different types of bags. We're going to talk about that shortly. There's a couple of different types of bags, but a catheter and a bag go together. Make sense? Good? Okay. This is a big risk for the patient because when we have an always open door and we have it leading to a bag that we open to empty, if we allow pathogens into this bag, those pathogens are going to multiply and they're going to start to climb. And they're going to keep climbing. And they're going to keep climbing. And eventually, if we leave that bag on long enough, those pathogens are going to get into the catheter. Now, this is clear on purpose because it's warm and it's moist, but it's not dark. So we're removing the dark. So we're not giving them the ideal environment. But once they get into that catheter, ooh, that urine really warm now. That catheter, dark. This is now an ideal environment. We don't want pathogens into the catheter, which is why we change that bag out weekly. This is why you also have to be trained, because if you change that bag out and you introduce pathogens right here, this is a day trip for a pathogen. Day trip. It'll go from here into the bladder in a very short amount of time as it procreates and it goes. Make sense? So we have to have training to do this. This is also why you have to be a nurse to put a catheter in, because we definitely don't want pathogens here. All right. This is your pathogen in a catheter system. By the time it jumps out into the bladder, it has procreated and it has had an all-you-can-eat buffet and an open bar, and it is ready to go. And this is what makes catheters very dangerous for patients. This is why I said back last week when we were talking about pericare that we don't use catheters unless we have a need to use catheters. If the urine cannot come out on its own, if there's a tumor, if there's a neurological problem, if there's a trauma, or if the urine comes out on its own, but it's inconvenient, if we have a big bed sore, if your patient's having surgery, that type of thing, that's when we use catheters. We don't use them for convenience. If your patient is incontinent and the urine comes out all on its own, they do not get a catheter. We do pericare every 2 hours. Do not think that incontinent patients are going to get a catheter to control that flow of urine, because that catheter puts your patient at way more risk. Does that make sense? It didn't used to be like this. Back in the 70s, when you went to the hospital, everybody got a catheter. You might be there for a broken leg. You're going to get a catheter. We used to put them in everybody. But we didn't really understand this whole bacterial load thing back then. We were just looking at convenience. So there's 3 places that pathogens can enter the system. This, where we empty it, this, where they connect together, and this, where it's put in. Nurses take care of this one. CNAs take care of this one. CNAs with training can take care of this one. Now, why do I bring this up? Because one of our skills is going to be to empty the drainage bag. Unfortunately, there are a fair amount of students that when they go to empty the drainage bag for the test, they disconnect it from the catheter and carry that whole bag over to the bathroom to empty it. Are you allowed to disconnect? No, because when we disconnect, it allows pathogens in. Good. There's actually a video on YouTube. I saw it like a year ago. I'm hoping they took it down. I don't know. That actually shows that. It was a student video that practicing for the test that actually shows that. Please do not disconnect the bag from the catheter. Not good form at all. Bag should always be above the level of the floor so that we're not allowing that bacterial penetration on the outside of the bag. Don't ever raise a bag above the level of the patient's hips. That's recycled urine, because the urine is going to flow right back into the patient. I don't know about you, but urine should be a one-way trip. That's pretty gross to think about urine going back into the body. And any bacteria, any pathogens that are inside that catheter, it's like a water ride. Woo! Right into the bladder. Super easy. So we don't ever raise the bag above the hips. Now, if you watch any Discovery shows, every so often you'll see somebody walking a patient down a hallway holding a bag up like this as they're walking. Don't do that. Don't do that. That puts your patient at risk. Be careful about this. Tubing that's coiled near the floor, your feet will get tangled in it and you'll pull that catheter out. Yeah, CNAs pull out way more catheters than patients do. We get concerned about patients tugging on their catheter, especially dementia patients. They'll absolutely tug that catheter right out, no problem. We try not to put catheters in dementia patients whenever possible. If we've got another way of doing it, we're going to try that, because patients will pull it out. And that's bad. I mean, it's going to hurt. They're pulling a ball this big out of a tube that big. It's going to tear. You're going to get a little bleeding. Your patient will be fine. Don't panic. But we'd like to avoid that whenever possible. But CNAs pull out way more catheters than patients do. Remember, we learned how to transfer a patient out of bed and into a wheelchair? Now, I just got that bag off of the bed. Which side of the bed was that bag on? That one. If I transfer the patient into a wheelchair over here and that bag is over there, I'm going to pull that catheter right out of that patient during that transfer, because it's not going to stretch that far. What if I got this patient up to walk them and forgot they had a catheter? As we get up and we start walking, they're going to walk right out of that catheter. Yeah. We come along and get our feet tangled up in the tubing and pull it out. When we turn a patient onto their side, if we trap that tubing between our leg and the bed as we turn them, it'll come out. Yeah, we pull out catheters like there's no tomorrow. So we want to be careful to always check. If you're going to move a patient in any way, check to see, do they have a catheter? Don't rely on your report sheet, because maybe a catheter was put in at the very end of last shift and it wasn't relayed to the CNA that went off shift. Look. If you're going to move that patient in any way, look for a catheter. Otherwise, you will do this. You'll only do it once, though. You'll only do it once. Because when you realize the impact on this patient, you'll start looking for those catheters. And you, by the way, deserve the lecture you're going to get. If you pull a catheter out of a patient, you deserve the lecture. Don't get defensive. That was your bad. And there's a consequence to that. There will be a lecture. And you deserve it. Okay? We all have to own up to our mistakes. They do happen. But sometimes your patients pull them out. Sure, absolutely. They do. They absolutely pull them out. If a catheter comes out, don't hide it for the next shift. A lot of CNAs will do that too. I don't want to deal with it. Don't want to deal with the paperwork. I'm just going to leave it in bed and let the next shift hide it. They'll be here in, a little while anyway. Let's not do that. Let's own up to this. I went in the room, patient's catheter was laying in bed, but we got to talk about what we're going to do with this catheter. We don't want to just throw it away. Now, the reason for that, let me see that catheter bag real quick. If a catheter comes out, thank you. If a catheter comes out, I walk in the patient's room, bag's hanging on the bed, and the catheter's laying there like this. Okay. And I see that. I'm going to put on a pair of gloves. Obviously, it's body fluids, got to have some gloves. I don't want to just pick this up and take it over and drop it in the trash can because I've got to let the nurse know, hey, the catheter came out. And nurse's responsibility is to look at this catheter. Now, if this catheter comes out and the ball is still inflated, that tells me it's intact. That's good. That means everything associated with this catheter came out. Nothing was left behind. But sometimes, especially if the catheter has been in a little while, or my patient's urine is particularly acidic, it can eat a part of this balloon. And that lets the balloon burst, and the catheter is going to slide out. So sometimes it's not even the patient's fault, right? So if that happens, if this balloon is not inflated, I have to look to see if a piece of that balloon is still inside the patient. The only way for me to know that is to look at it. Now, if you put the whole thing in the trash bag, that doesn't help me a bit. What I need you to do is put it in an empty trash bag. There's always an empty trash bag on the bottom of your trash can. So take the bag out, grab an empty one, put this whole thing in that empty trash bag, put it in the bathroom, and go let your nurse know, hey, catheter came out. It's in a bag in the bathroom for you to be able to inspect. And your nurse will be your new best friend. Now, if the whole thing comes out, that's a problem I can deal with. Yay. If a piece of it was left in the patient, that is not a problem I can deal with. That involves going fishing. And I need a doctor with a camera to go fishing. You guys see the difference there? Yeah, that's no good. All right.
So it's okay for it to be inflated, you can inflate it to take it out, but as long as it's not punctured or ripped. then it's-
So if it's inflated when it comes out, it's going to hurt like crazy. Okay. It's not going to be comfortable for your patient, but that's okay. That's something I can deal with. If it's deflated when it comes out and there's a hole in there, that's not a good thing. That means that a piece was probably left behind in the patient's bladder. And we don't like extra things in the patient's body because that can often lead to reactions. Good? Makes sense? All right. And so CNA should always be aware of when a patient has a catheter so it doesn't get accidentally pulled out. That's a big thing with catheters. If a catheter does come out, we simply put it in a plain, unused bag, put it in the bathroom, let the nurse take care of it. Now, you want to let me know really quickly because anytime we have injury, guys, we had a bubble this big go through a space this big. There's an injury there. There's definitely an injury there, right? Anytime we have injury, we have swelling. This is not a place you want swelling. This is not a good place for swelling. So that means that I only have about 45 minutes once a catheter comes out. If the balloon was intact, if I know there's been trauma, there's going to be swelling. I've only got about 45 minutes to get another catheter in before the swelling gets so bad I can't put one in. So if a catheter gets pulled out and you don't come tell me, and 2 hours have gone by and you're getting ready to end your shift, you go, oh yeah, by the way, patient's catheter came out. There is nothing I can do for that patient. Not a thing. They are stuck peeing through that tissue that is swollen and torn. And until that, swelling goes down, there's not much that I'm going to be able to do for that. Good. So make sure you let the nurse know right away so that we can explore our options. Now, doesn't mean I'm going to put another catheter in. If they pulled this one out and they pulled the last one out, probably a pretty good chance they'll pull the next one out too. So catheters may not be the right solution for this patient. Let's troubleshoot and see if we can come up with something different. Okay, good. There's a couple different types of catheters. Now, the one that I passed around, thank you. The one that I passed around is this one. This is an indwelling catheter, also known as a Foley catheter, and it's the one that has that little balloon that keeps it in place. So indwelling just means we put it in, it stays in. But sometimes we don't need a catheter to stay in. I just need a urine sample. That's all I need. I need a little bit of your urine. I don't need a bubble because it's not staying in. In that case, I'm going to use this type of a catheter called a Red Robinson, also known as a straight cath or an intermittent cath. You'll hear it called all three. This one doesn't have a bubble. It literally just gets put in. We get some urine out of here into a container, and then we slide it right back out. It's in very, very short time, and it has to be held in. So I put it in, I don't move. I'm stuck here till I get my sample, and then I pull it right back out. Good? Then we have this. This is called an external catheter, also known as a Texas cath or a condom cath. This is for males only. This goes on like a condom, and as the urine comes out, this is usually for incontinent males, as the urine comes out, it's going to go through this tip onto the bag. It connects to the bag, just like these tips. It just connects to the same bag.
So what do you call the catheter that's going through that?
So a catheter that goes through the skin of the abdomen directly into the bladder is called a suprapubic catheter. Supra is above, pubic is the pubic bone. So this is above the pubic bone. And we make an incision and put the catheter right into the bladder. And we usually use this type of catheter because it's indwelling. It's going to be same catheter, it just goes in a different way. Okay, we prefer the ones where we don't have to drill. Right, no incision. We're going to go through a hole that's already there. Good? Does that help you? Okay, so if you're going to be, let's go all the way back to class 1 real quick. CNAs do normal. You guys remember that? CNAs do normal? Yeah, what I'm teaching you, catheter care is normal. Suprapubic catheter care, not normal. Who does not normal? Doctors or nurses. That's right. So caring for a suprapubic catheter would require a nurse. Now, that doesn't mean you can't be trained to do it, but that would require additional training. Remember, anything not normal requires additional training. Good? Okay. So even though you may see them, you're not going to be responsible for cleaning them without additional training because there's a higher risk of infection there. All right, so condom catheters or Texas catheters go on externally. They're sticky on the inside and they last for 3 days. So we put them on, we leave them for 3 days, we take them off, but we have had urine, which is acidic, right here. This is a reservoir tip. So urine has pooled right here, right against the tip of the penis. So when we take these off of your patient, your male patient, we understand that acidic urine has been against that skin for a long time. We want to do really, really, really good peri-care here. And our care plan is probably going to have us treat that skin with something called skin prep, which looks like an alcohol pad, smells like nail polish remover, but it provides, when we put it on, it becomes really sticky and tacky. It provides an extra layer of protection on the skin to help prevent that acid from penetrating. Okay. Good. So how do we do catheter care? Well, we clean the peri area and the catheter tubing. That's what catheter care is. So we're going to clean down the middle, the side, the skin fold, and the skin fold, just like we did with peri care. But we're going to hold that catheter out of the way while we do that. We're just going to hold it up out of the way while we clean those areas. Whatever we wash, whatever we rinse, we dry. We're going to use that leaves method. And then once we've done that, we're going to clean the tubing. Now I want to hold that tubing where it exits the body. So I want to hold that tubing, wipe my washcloth around, and wipe away from the body. I'm going to use that leaves method again. We'll do it 4 times. So I'm going to hold, wrap, wipe, fold. Hold, wrap, wipe, fold. Hold, wrap, wipe, fold. Hold, wrap, wipe, fold. That way, if we didn't get it with leaf 1, hopefully we'll get it with leaf 2. And if leaf 2 didn't get it, leaf 3 will. And then leaf 4 is our extra insurance. Whatever we wash, we... Okay, so we're going to rinse the same way. And whatever we rinse, we dry, same way. That's it. So we put a chucks under the patient to keep our bed clean. We clean the peri area, middle, side, skin fold, holding the catheter out of the way. We rinse, we dry. We hold the tubing, we wash, we rinse, we dry the tubing, and then we take that chucks away. That's catheter care. That's it. So I had to teach you all about catheters. I had to teach you about infection control, but catheter care itself, super easy. Good? Okay. So now we know all of our rules. Let's look at our specific steps for this skill. We're going to put a chucks under the patient. We're going to use our leaves method, middle, side, skin fold. Whatever we wash, we rinse. Whatever we rinse, we dry. And then we're going to hold the catheter as we clean the tubing away from the body. Make sure you're not tugging on the inside by holding it in place. You only have to go down 3 to 4 inches. Just clean the tubing. We're going to remove that chucks out from under the patient. We're going to inspect the bag, make sure that it's on a non-moving part of the bed and not near the floor, and it's not coiled where our feet can get tangled in it. So let's take those principles and apply it to this checklist. We're going to do our follow our care plan. We're going to do our opening. We're going to use our gloves. We're going to use a barrier on the table. We are not going on break. We are going to use a privacy blanket to cover the patient, keep them in the middle of the bed, use our washing rules, clean our basin the same way we clean everything else, do our skill-specific steps, and follow up with the closing. That's the whole skill. This care plan is only for this patient. These patients have a different care plan. Good? We're not going to watch the video yet. Let's get into graduate container real quick, emptying the drainage bag. And then we'll show you these 2 videos together. So down here, you can see the principles involved. These are our skill-specific steps. They're all spelled out for us here. Down here is our test information. Somebody with your level of experience should be able to do this in 9 minutes. We are taking the liquid out of that bag, putting it into this cup, taking it to the bathroom, measuring it, dumping it, cleaning it, and storing it. And they give you 9 minutes to do that. This is at most a 5-minute skill. Don't rush it. This is going to be done on a mannequin. That mannequin will be in bed.
So for like this skill and then the catheter care skill, were the evaluators already set up like that stuff?
Yep. So if you have catheter care, which is only on one care plan, the mannequin already has the catheter in place. It's already attached to a bag. The bag is hanging on the side of the bed. It'll already be set up. If you have this skill, which is emptying the drainage bag, that's on 2 care plan sets. Let's think about that for a second. Catheter care is only on 1. This skill is on 2. So one of these is going to be paired up with catheter care. So we have catheter care, we have emptying a drainage bag, and then we have another skill of some sort. It gets a range of motion. But we have 1 care plan set that has drainage bag and then 2 other skills. So they don't always go together for the test. 1 care plan set they do, but you can have this skill outside of that as well. But either way, if you get this skill, emptying the bag, It's already going to be on the bed. It'll already be filled with yellow water because you have to measure it. So they can't use just plain water. It has to be tinted so that you can measure it. So it looks like Mountain Dew. It's not. It's yellow water, tinted water. It'll be on the bed attached to the mannequin. Okay. All right. So here's our steps page, our care plan at the top, supplies at the bottom, step-by-step instructions. Here's your care plan. Empty the resident's urinary drainage bag into a graduate container and measure and record the urinary output in mLs or cc's on an intake and output form. So empty the bag into the cup, measure the contents, and document it. So if you look back on page 165, right here is the documentation sheet. But, 3 minutes. Congratulations. You're going to do great. Good vibes out to you. I'll keep our fingers crossed. We'll be here for a little bit longer. So if you find out your score, come back and let us know. We'd love to congratulate you. But yeah, you're going to do great. I have faith. So here's our documentation form right here. If you turn in your book to page 169, you can see a bigger version of this form. So what do you need to know? There's there's many different kinds of bags, but they really kind of fall into two camps. There's a bedside bag, which is what we have here, holds a lot of urine and it hangs on the side of the bed. These are not very portable. If you're going to go walk around Aldi, you don't want to take a suitcase of urine with you. Okay, that's just a little weird. So usually if somebody is out and about in public, they use something a little more discreet called a leg bag. This is a smaller bag. It has elastic straps that straps to the leg, and it doesn't tie the patient down. They can go wherever they want to go. It actually looks like this. So it can be strapped to the thigh or the calf, depending on the patient, and it holds a little bit of urine, not as much as that does. So it's going to have to be emptied a little more often. Good. So leg bags are designed to make your patient portable. Bedside bags are designed to hold a lot of urine over a longer period of time, usually at home or in a clinical setting. Both of these are attached through that same port on the catheter. Again, you can be trained to connect these two pieces. All of these have to be emptied though, and they are all emptied a little bit differently. They have ports. This is a T valve. This is what I'm going to be passing around in here in just a few minutes. There's also a clamp valve that's used in some settings, and then the leg bags have a twist valve, So when you go to work, wherever you go to work, you're going to have to be trained on how to use the bag that's in your particular setting. Whether it's a T valve, a clamp valve, or a twist valve, don't try to figure it out on your own. Have somebody show you how it works so we don't accidentally contaminate our patients' bags. Good? Okay. Remember that CNAs have to have training to change the bag out. Jake, I'm going to need a Zoom. Let me show you how a T valve works. Okay, so this is a T valve. It has a little house. Can you guys see? I don't know. I might be in your... Yeah, I might be in their way, though. I'm standing right in front of the... I'm going to step to the side, Jake. Follow me. There. Now you'll be able to see the screen. Okay. So this bag, there's a little house. You're good. Right here. There's a little house that our port slides into. Do you guys see the house? When you take this port out, you cannot touch this end of it. Not with your hands, not with the gloves, not with the cup, not with the bag, nothing. Because this is how pathogens are going to enter the bag. So we don't touch this with anything. We've got to be really, really sensitive about that. Down here is the T. This opens. This closes. Good. If you look through here, let me see if I can get, this is tricky to do. Okay, there we go. If you look through here, when I open this, there we go. See how it's open? If I close it, now it's closed. Okay. Now notice I did not put my finger up here for leverage. It would be a whole lot easier to do this, to open it or to close it. But I can't touch this end. Everything that we do is on the back side of that T. Does that make sense? Once it's empty and you close it, please make sure it's closed before you put it away. It must be closed. Then we're going to very carefully slide it back up into our house without letting it touch anything. We're not going to do this. Very carefully. We want the tip of that catheter to touch as little as possible. Thank you, Jake. Now, what we used to do is have people clean the end of the catheter, the tip, the emptying port with an alcohol pad. And that sounds like a good idea because it removes any pathogens that you might have come into contact with. And we did this for years and years and years and years. Well, somebody did a study and actually found that the alcohol dried out this material, which caused microcracks to form, which allowed pathogens to hide more easily in the microcracks, and it actually was counterproductive. So that is no longer a recommended action. The recommended action is don't let that port touch anything. So I'll let you guys play with the T port.
So what happens if we do that?
Let the nurse know. And this is why we change them out every week. We just assume that pathogens are going to get into that bag. But if we change it out every week, it doesn't have enough time to get all the way to the catheter. That's why the bags are changed at that frequency. Okay, so to open a T valve, we're going to slide the T to the side. We're going to empty it, not letting that port touch anything. It can't touch the cup. It can't touch the bed. It can't touch your gloves. Can't touch anything. And then we're going to close that port and put it back into its little house at the end. Good. All right. When we do this, we want a barrier on the floor because if we spill urine, we don't want urine on the floor. So we're going to put a barrier on the floor. We're going to put the cup on the barrier. We're going to open the port. We're going to empty the bag. We're going to close the port and put the port back into its little house. Don't let that port touch anything. This is the critical checkpoint on this particular skill. Now, once we've emptied the urine into that cup, we're going to take it to the bathroom to measure it. It has to be measured on a barrier, on a flat surface, at eye level. All three of these things are on one line. So if it's not on a barrier, you don't get credit. If you're holding it up, you don't get credit. It's got to be on a barrier, on a flat surface, and at eye level to get credit. And we're going to measure to the nearest line. Our care plan told us to measure in mLs or cc's, so we're using this side, not ounces. If you look here, you can see all the markings, and they're marked in 50s, 250, 300, 350, 400, 450, 500, and so on. Little tiny marks in between are your 25s. If this is the line for 300, that's 325. There's 350, 375, 400, 425, 450, 475, 500. That's what we're going to use for our measurement. We're rounding to the nearest line. Do not write 412 cc's. You cannot show me 412 cc's on here. You're going to round to the nearest line. Good?
Rounding up or down?
Doesn't matter. Nearest line. Nearest line.
So where it says the test info, it says the variance, is that kind of like vitals we can be in like a range?
Right. So let's look at this right here. How much urine is in this cup? Can you guys see? Get close. 450. So this is the line right here for 450. It's just barely itty bitty bit below that line. We're not going to call it we're not going to call it, we're going to, nearest line, up or down, doesn't matter. We're going to call that 450 because it's nearest the 450 line. Good. Now, if the evaluator put 500 or the evaluator got 400, we're still accurate. 50 cc's in either direction off of the nurse's read. Charlotte says, thank you, Miss Patty. I passed my written exams today. God bless you. Congratulations. Super proud. I'm so excited for you. Congratulations. Thanks for stopping by and letting us know. Oh, here's a better view for you. Okay. I thought I had a better one. All right. So when you're looking at this, we're going to round it to the nearest line. So we see all of our markings here. This line is right at the 450 mark, and that's what we're going to use, 450. We're going to document this after we're all done on an intake and output sheet, but this is so important, guys. There is intake on this sheet and there is output on this sheet. Is urine intake or is it output? Output. If you accidentally, on the test, put it in this block, you are likely to fail. Now, in your mind, you're thinking, oh, I just put it in the wrong block. What's the big deal? Why did they fail me over this? Well, that's because this is a legal document and that lawyer does not have a sense of humor. And in a clinical setting, if you document it in this block, you are saying, hand on the Bible, I swear that this patient took in 450 cc's of urine. And like I said, lawyers are not known for their senses of humor when millions of dollars are on the line.
If it does occur, though, you can just cross it out and still pass it.
One line, cross it out, write error above it with your initials, and then document it in the correct area. Okay, great question. So the question is, do we need to use military time? Are we graded on it? And the answer is no, you are not graded on military time. I would like you to learn military time because it is used in most institutions. Healthcare happens 24 hours a day. So we use a 24-hour clock because it gets really confusing if I tell you to do something at 5. Is that 5 a.m. or 5 p.m.? Because healthcare happens at 5 a.m. just as much as it does 5 p.m. So we do need to learn military time. And I have a whole lesson on that in your book on page 20 something. I think it's 29 if I'm, hold on, I'll help you. 49, sorry, 49. I have a whole lesson on military time. To me, military time, I'm a very logical thinker. Oh man, my brain is linear. So how many hours are in a day? So who is the idiot that said, okay, let's count to 12 and then, I don't know, start over? If there's 24 hours in a day, let's use 24 hours. And that's all military time does. Instead of getting to 12 and starting over at 1, like, who does that? Why? We just keep going. Instead of 1, it's 13, 14, 15, 16, 17. And that, to my logical brain, just makes so much more sense. Why are we starting? Did people back then only know how to count to 12? I mean, because then now you've got the whole, well, is it AM or is it PM? And there's a lot of chance for error there. Military time, much better. So, but no, you're not graded on it. If for the test, you are doing this skill at 12:10 p.m., you can write 12:10 if you know that's all military time, 12:10. Or you could write 12:10 p.m. If you put a colon in there, you must indicate a.m. or p.m. Okay. No colon, military time. Good. Page 49 teaches you all that. I have a whole lesson on my online course about military time too. All right, so here's our care plan. Empty the resident's urinary drainage bag into a graduate container. Measure and record urinary output in mLs or cc's on the intake and output form. Now, while we were watching the last video, I was scrolling, and if you're on here, I apologize, but you put it on social media, so it's fair game. I'm scrolling, and in one of the groups was a student, not one of mine, some other student, who was showing clips of her performing skills. And one of the skills that she had was bedpan, and she poured it into a urinal, I guess, to measure it, which is not something that we have to do, right? We're just dumping it. But she poured it into a urinal to measure, which is fine. But then she put that urinal on the counter without anything under it. Yeah, we can't do that. If it's got body waste in it, it deserves a coaster under it. Okay? So if you're in any of the CNA groups, go find it. All right. And then we, for Prometric, are using a graduate container, not a urinal, because this allows us to measure. It's printed in black. It allows us to measure a little more easily. Good. We know all of this. We're going to go over this. We're going to use a barrier on the floor to protect the cup. We're going to empty the bag. We're going to make sure we don't touch anything with that port. We're going to put the port back into its house without touching anything. We're going to wrap our container with our chucks. Remember, we don't ever carry an open container of urine through a room. So we'll use that chucks to wrap. We're going to take it to the bathroom, set it down on the lid of the toilet, and we're going to get down and measure at eye level. We're going to empty it in the toilet because that's where urine goes. We're going to look at our bag, make sure it's not on a moving part of the bed, it's not near the floor, and the tubing isn't tangled. We're going to do our closing, wash our hands, document on the output section, and then we're going to end skill with clean hands with our closing. Questions? This care plan is only for this patient. Other care plans may ask you to do something different. This care plan is for this patient. So this is our checklist. We're going to follow our care plan. We're going to do our opening. We're going to wear gloves. We're going to use a barrier. We're going to clean our basin the same way we clean everything else. We'll use our skill-specific steps and do the closing. All right. Practice kit. Wednesday's your last day to buy a practice kit on sale. After that, you can buy them online all the time, but I'm going to charge you full price. So if you want a practice kit, make sure you're getting it on Wednesday to save yourself some money. This practice kit has the drainage bag and the cup. This cup. I'm going to pass this around while I've got the video going, but it has the drainage bag and the cup, as well as everything else you need to be able to practice all of these skills. Good? Oops, nope. Okay, so I'm going to show you both of these videos, one right after the other, and then after that, you'll have time to practice. In the meantime, I'm going to pass this around so you guys can see it. Take a look at it while you're watching these videos. Good afternoon, Mrs. Jones. My name is Patty. I'm your CNA today. How are you? Wonderful. I'd like to perform catheter care. Is that okay? Okay, I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be right back. Now that I have clean hands, I can get my clean supplies. We're going to place a barrier on the table with the absorbent side facing up. This gives us a clean area for our clean supplies. And for this skill, we're going to need 1 underpad. We're going to need a towel, 4 washcloths, 1, 2, 3, 4. We're going to need a privacy blanket. We'll bring this over to the patient area. And I'm going to need a basin and soap. And a set of gloves. All right, Miss Jones, I'm just going to fill your basin. I'll be right back. To fill the basin, I'm going to use a paper towel to turn the faucet on because my hands are clean. I'll use my wrist to feel the water temperature. It should feel warm, not hot, not cold, just warm. And we'll fill the basin about 1/4 of the way full. Mrs. Jones, would you like to check the water temperature? It's good? Wonderful. Okay. I'm going to place this privacy blanket over you, and this is going to help keep you warm and provide privacy as we do this skill. So I'll lay the privacy blanket over the sheet without snapping it or shaking it, and then pull the sheet down to about your waist. I'll put the washcloths in the basin. That way they get warm. And I'm going to prepare the underpad to go under the patient. I'll open it up. I'm going to hold it up lengthwise with the absorbent side facing me, and I'll roll it all the way to the end. Now I can put my gloves on. Okay, Miss Jones, we're going to place the underpad under you to keep your sheets dry while we do this skill. So I'm going to place an underpad on the bed. And in just a moment, I'm going to ask you to scoot toward me. I'm going to roll you on your side, and then we'll spread that underpad out. So on the count of 3, go ahead and scoot toward me. 1, 2, 3. Thank you. And now I'm going to roll you on your side. 1, 2, 3. And as I roll the patient, I want to be careful not to put any stress on this catheter or the tubing. You don't want it pulling tight. So I'm going to unroll the chucks underneath the patient and tuck it under her hip. Miss Jones, come on back and scoot to the middle of the bed, please. Okay, Miss Jones, we're going to repeat the process. Go ahead and scoot toward me. And we're going to roll you onto your left side. 1, 2, 3. And I'll smooth that chucks out underneath the patient. Come on back onto your back. And then scoot to the middle. Now we can begin the cleaning. Miss Jones, I'm going to expose you. I'll make this as brief as possible. But please let me know if you're uncomfortable in any way. I'm going to roll the privacy blanket, making sure that I get the gown inside the blanket as I roll it. But I don't want to grab that catheter as I'm rolling the blanket. So you want to be very gentle with this process. This is going to expose the peri area. And then I'll place a towel over the upper thighs and make sure that the catheter tubing is on the towel. This is to help minimize exposure, increase comfort, and gives a place to put the catheter while we're cleaning it. Now I'm ready to start cleaning. I'm going to take my first washcloth, wring it out, and I'm going to soap 5 corners. 1, 2, 3, 4, 5. I'm going to hold the catheter out of the way, retract her labia, and then wipe down the center, top to bottom, and then move away and fold that leaf. The second leaf will wash the outside of the labia, top to bottom. We'll fold that leaf over. This is going in one direction only, top to bottom. This third leaf is going to wash the other side of the labia, top to bottom. We'll fold that over. The fourth leaf will wash the skin fold between the leg and the groin, top to bottom. We'll fold that over. The last leaf will wash the skin fold on this side, top to bottom. Now we'll set that aside on the barrier. And whatever we wash, we rinse. So we're going to wring that washcloth out really well. Hold it using the leaves method. I'll hold the catheter out of the way and open the labia and rinse down the center one direction, top to bottom. We'll fold that over. We'll rinse the outside of the labia, top to bottom, fold that over. The other outside of the labia, top to bottom, fold that over. This is going to rinse the skin fold. Fold that over, rinse the skin fold. We'll set that aside. Now we're going to clean the tubing. So I'll get washcloth number 3, wring it out really well, hold it using the leaves method, and I'm going to soak 4 leaves. 1, 2, 3, 4. I'm going to hold the catheter where it exits the body so it doesn't pull on the inside. Wrap the washcloth around the catheter and wipe away from the body. We're going to fold that over and repeat 3 times. Hold the catheter, wipe the washcloth around, and move away from the body. 2, 3, changing the leaf for each stroke, and 4. We'll set this aside. Whatever we wash, we rinse. I'm going to wring the rinsing washcloth out thoroughly, hold it in the diamond shape in my hands, hold the catheter where it exits the body, wipe the washcloth around, and rinse going down the catheter. We'll fold that leaf, rinse 2, fold that leaf, rinse 3, fold that leaf, and rinse 4. We'll set that aside. Whatever we rinse, we dry. So we'll dry the peri area top to bottom and the catheter tubing. We can remove the towel, set it on the table, and we're going to unroll the privacy blanket, trying to be careful not to touch that gown with your soiled gloves, and we'll cover the patient up. Mrs. Jones, can I get you to scoot toward me, and I'm going to remove the pad that's under you. Go ahead and scoot toward me, and on the count of 3, you're going to roll up. 1, 2, 3. I will roll the soiled chucks toward the patient and tuck it underneath her hip. Come on back, Miss Jones. When I'm moving Mrs. Jones, because my gloves are soiled, I'm only touching the outside of the privacy blanket. Mrs. Jones, scoot to the middle of the bed, please. And now we can remove your chucks. If you can scoot toward me, again, my soiled gloves are only going to touch the outside of the blanket. And then you're going to roll up on your side, 1, 2, 3. And I'll remove that chucks from under the patient. Come on back onto your back. And then if you can scoot to the middle. Thank you. I'm going to go dispose of this. Okay, Mrs. Jones, you're covered. You're safely in the middle of the bed. I'm going to go dispose of your linens and clean your basin. I'll be right back. These items will go in dirty linen. We're going to clean this basin the way we clean all basins. I'll bring the basin to the sink and we'll dispose of the water in the sink. Rinse the basin and then dispose of the rinsed water into the sink as well. I'm going to set that down, disinfect it per facility policy, and then pick it up with a paper towel. I'm going to get a clean paper towel to dry the inside. I'm going to get a clean paper towel to dry the outside. And then one more for the drawer. On the way, we'll pick up the soap, place it in the basin, use the paper towel to open the middle drawer, pick up the lotion and put it in the basin, and then store the basin in the drawer. We'll close it with a paper towel and then throw those paper towels away. Now we can dispose of the barrier. This will go in the garbage. And I can remove my gloves. Okay, Ms. Jones, I'm going to remove your privacy blanket now. I want to check your tubing real quick just to make sure that it's not kinked and you're not lying on it. So it looks good. It's not near the floor. So I'll pull the sheet up over the privacy blanket. This ensures that you're always covered. And I'll remove the blanket as I do so. I want to make sure that the blanket is rolled into a ball so trailing edges don't contaminate other surfaces. We'll make sure that the sheet looks good. All right, Ms. Jones, just let me go dispose of this in dirty linen. I'll be right back. We'll adjust the sheet on this side. There you go. Is there anything else I can get for you while I'm here? Are you comfortable? Would you like a magazine? Your bed is in the low position. Your environment is clean. Here's your call light. If you need anything at all, go ahead and press the red button. We'll be happy to come help. I'm going to open your curtain and return your overbed table to storage. Now I'll go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. Good evening, Mrs. Jones. How are you today? Fantastic. I need to empty your urinary drainage bag. Is that okay? I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be right back. After washing my hands, I'll get my supplies. We're going to start with the chucks. This is going to go on the floor under the bag. We're going to place the barrier on the floor directly under the urinary drainage bag. So we'll unfold it and we'll place it under the bag with the absorbent side facing up. I'm going to go get a set of gloves. And we're going to get the graduate container out of the drawer. You need to make sure that you put your gloves on before you get the graduate container. We're going to place the container on the barrier directly underneath the bag. We use the emptying port to empty the bag. This is a T-valve. We slide it to the side to open the valve, and then we're going to empty the urine into the graduate container without letting that port touch anything. Once the bag is empty, we'll close the port and place it back in its little house. All right, Ms. Jones, I just want to check to make sure the tubing is coiled on the bed and you're not lying on it, and that it's not coiled near the floor either, where it could become a tripping hazard. Now, I can wrap the chucks around my graduate container for safe and secure transport to the bathroom. We're going to set it down on the lid of the bedside commode and unwrap it, turning the cup around so that we can read the amount of urine that's in the cup. We need to be at eye level. It needs to be on a flat surface and on a barrier. I'm going to throw the chucks away. Open the lid and the seat and dispose of the urine into the bedside commode. I'll rinse the cup and dispose of the rinse water into the bedside commode as well. We'll close that, set the graduate container down in the sink, and disinfect it per facility policy. I'll pick it up with a paper towel, dry the inside with a paper towel, throw that away, dry the outside with a paper towel, throw that away, and one more for the drawer. Okay, Miss Jones, I'm just going to return this to storage using a paper towel to open the drawer. And closing the drawer, we'll throw those paper towels away, and then I can remove my gloves. You take a peek at your tubing just one last time. Everything looks good. Are you comfortable, Mrs. Jones? Is there anything else I can get for you while I'm here? No? Would you like a magazine before I go? Your bed is in a low position. Your environment is clean. I'm going to open the curtain. Here's your call light. If you need anything at all, just press that red button. We'll be happy to come back and assist you. Thank you very much. I'm going to go wash my hands. After washing my hands, we'll document the amount of output on the documentation sheet provided by the evaluator. We're going to document the time of output, the type of output, which is urine, the amount of output in cc's, and my initials. We want to make sure that we're documenting in the output section. After documenting, I'll wash my hands one final time. After washing my hands a final time, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done. I had an instructor call me Wednesday after class, and she says, I gotta call and tell you, all of my students took the test and they all passed. She says, but one of the students made a mistake on range of motion, did the wrong side. And she stood there and she heard my voice in her head, think about my skill, read the care plan. And she did, and realized that she had made a mistake and made a correction. And she says she came out and she was so thrilled that she heard you and it helped her pass. So I know I say the same things over and over and over again, but that's so that it worms its way into your head. And hopefully it will help you catch those mistakes that you make on the exam.
When you pour it into the bedside commode, we just leave it there or wash that too?
So for the test, we're just going to leave it there. And CNAs do empty the bedside commode, usually once or twice a shift or as needed. Okay. All right. We do have a question from Kimmy. It says, we were taught to clean the tube with alcohol. Go by your facility policy, go by your testing standards. I would review that with your testing checklist specific for your state. Prometric does not require that. And from what I have read with the CDC and the NIH, that is no longer a best practice. So go by your protocol for wherever it is that you're going to be testing, though, because that hasn't, kind of moved through all protocols yet. All right. Jake passed out the review sheets for today. Homework for tonight is chapter 10. Chapter 10 is super easy, guys. It's all on employability, stress management, communication, that type of stuff. So you're ending on a super quick, super short, super easy chapter. You will get a wrap-up email after class today that has links to everything. Next class is Wednesday, and you are going to be returning the yellow book on Wednesday, so please bring it back to me on Wednesday, but you get to keep this one. QR code for the CPR class again, just in case anybody needs it. And there's the review sheet for today. Those of you that are tuning in virtually, you also have access to these review sheets on our website, flcnatraining.com. You can print them off. They're right beside each replay. You can print them off and use them just as much as our students do. So we will see you on Wednesday. You definitely want to tune in for Wednesday. I'm going to explain to you how to find a job in healthcare. It is different than other agencies or other industries, and how to answer that question. Tell me a little bit about yourself in a way that's going to let you ace that interview and is specific to you. So tune in on Wednesday for that. Tomorrow is the game show at 11 a.m. on our YouTube channel for your CNA. So hope to see you there. Until next time, happy caregiving. Bye.